absolutely want to, anytime you're traveling with your cat, have them in an enclosed carrier of some sort. It's very important that that carrier not move around the car. No more would you put a child in a car seat that wasn't affixed to the car with a seatbelt than you should a carrier, because a carrier becomes a flying missile in case of an accident. The safest place for a carrier, and it's been shown by some crash test dummy work in Germany, is actually having the carrier in the footwell behind the front seat. Once you're in the clinic with your cat in the carrier, it's important that that the cat not be exposed to other animals, even really friendly ones, like a dog wanting to sniff at the carrier, or one of the clinic cats wanting to come around, or any other animal. The cats are naturally frightened about being in the clinic, and that fear may present either as cowering, or it may present as defensiveness. And in either case, if the carrier is either you keep it on your lap, or on the bench beside you, or on some clinics have special shelving for the carrier, and put a towel over it so the cat can get some light, see around should they wish to, but they don't have somebody else in their faces.
Good evening.
Meow.
It does work.
It does work. Good evening, everybody. Thank you for joining us. Before we get started, we just wanted to take care of some housekeeping rules. This is a cat event, but we will have no peeing outside the box tonight. So if you do need the litter box, if you head down the hallway and turn kind of left where the hallway naturally goes left, the washrooms will be on your right-hand side. For those of you who parked underground, make sure that you received your parking validation from the girls that you registered with out front. So if you didn't get that, make sure that you ask for that before the end of the night so that you don't have to pay for your parking. And then, of course, if you can, please make sure that your cell phones are on vibrate so as not to interrupt the evening.
All right, well, before we kick off the official presentation, a few other things. We just wanted to say good evening to everyone. My name is Emily Moon, and this is my good friend Tara Kempt. We are from Royal Canin, and we are positively excited to welcome you here this evening, dedicated to making a better world for cats. We're so grateful that we were able to persuade you to join us this evening with our special guests to share this presentation on how to build a forever home for cats.
A Royal Canin first in partnership with the Hamilton Burlington SPCA, Cat Healthy, and the City of Hamilton. And in this room, you will find people from veterinary teams and area shelters. And in the spirit of collaboration tonight, you'll notice that you all do have name tags. We wanted to have a theme where people can get to know somebody that you might not have known before. And there are stickers on your name tag. So those of you who have little kitty cats are veterinary partners. And those of you at the smiley faces are our shelter partners and also our pet nutrition advocates that work for us here at Royal Canin, doing events and supporting us that way. Joining us via Skype also are others like you from around the country. So we're really excited and would like to give a warm welcome to those of you listening at home as well. And as Emily pointed out, this event is to showcase on how working together and collaboration between shelters and our veterinary teams can help to provide a better life for cats.
Okay, so just before we get to the canned slices and gravy of this evening, we wanted to share this little clip produced by our partners at the Hamilton Burlington SPCA to get your catitude adjusted perfectly.
Well, hi, I'm Cindy. I've never done this before. You? I was alone for a really long time, but now I'm ready to share my life. Oh, you're just gonna leave? Just gonna go? Okay. Cool. Oh, hi. Well, clothing optional, I guess, eh? So, how old are you? Because it's hard to say. I like older men. I do. Oh, a lot of PDA here. Milady, you may kiss my hand. He just walked out the door and he said, you know what? It's either me or the sofa. And I was like, I am not getting up the sofa. I know you know what I'm talking about when you just love a sofa and you just can't, can't let it go. What are your thoughts on laser pointers? Well, I'm sorry, I prefer if you were snipped. So maybe this is the end for you and I. Yeah, you should move on. Oh, this is a bit different. You are really handsome. Want to get out of here? Okay, let's split. Oh, somebody is anxious to go. Okay, here we go.
Well, we think that video suggests that tonight is all about celebrating the clever, the curious, the sassy, lovable, inside the box type of thinker, the cat. So this evening is also about showcasing the determination and the results of the efforts put forth by the community to keep these magnificent cats in their forever homes. We're going to take a brief moment and we're going to introduce our wonderful guest speakers who are joining us tonight, sitting at the lovely table in the front. That's okay. So I am very pleased to introduce our first guest speaker, Marianne Emo, the CEO of the Hamilton Burlington SPCA, Mother of Dragons. Oh, wait, sorry, that must be a typo. I think that should say Mother of Cats. Marianne is a Montreal native and has served in the health sector in Ontario for over 20 years for the wellness of people and communities. When she discovered that these imperatives are much the same in the animal world as when she joined the Hamilton Burlington SPCA. With Marianne's leadership and commitment to collaboration, the Hamilton Burlington SPCA continues to be an innovator and contributor of knowledge. Thank you for joining us, Marianne.
Next, we'll have Dr. Liz O'Brien, who is a board certain right here in the corner. There she is. A board certified feline practitioner and owns 2 feline practices right here in Hamilton, the Cat Clinic and Village Cat Clinic, where she continues her work as a veterinarian / cat whisperer. Yeah, and is a passionate advocate for the welfare of cats. Dr. Liz is the visionary for Cat Healthy, whose mission is to increase the value of cats in communities across Canada. So welcome, Liz, and thank you for coming this evening.
So I'm also delighted to introduce the third speaker, Jane Murrell, who has not only 1, but 2 bachelors of science, 1 in human health and 1 in environmental health. So I would feel like it's a good synergy, a lot of healthy happening here. So much that you're a certified public health inspector. Jane has become an integral part of the Hamilton Rabies Response Team as the lead for rabies awareness, education, and risk assessment, for which I am forever grateful, as I've had the rabies vaccine after spending an unsuspecting night in bed with a bat. He did not get a second date. So Jane, thanks for joining us tonight.
Last but not least, we have our very own Dr. Jackie Parr joining us, also known as the Kibble Queen. And I've heard there's quite a fan club of the Kibble Queen here this evening, so you may get mobbed. Jackie graduated from the Ontario Veterinary College of Guelph, and after finishing her DVM degree, she moved to Boston for a rotation and small animal internship, followed by a residency in clinical nutrition at the Angel Animal Medical Center. She began working for us here at Royal Canin in 2015. And as if that's not hard enough, because we keep her very busy traveling around the country, educating veterinary teams such as yourselves. She's also adjunct faculty at OVC, where she teaches veterinary students in all 4 years of the vet program, and is a master's student advisor as well. So thank you, Jackie, for joining us. The Kibble Queen. It is now 6:37. We'll be starting promptly at 6:45 to make sure that you are out of here on time by 9 o'clock. So please take some time to go and grab a coffee, use the washroom. There are no formal breaks, so please just get up at your leisure and make yourselves comfortable. Beginning, we will have Marianne Emo speaking about laying the foundation, followed by Raising the Walls with Dr. Liz O'Brien and Jane Murrell. And last but not least, we'll have Jackie speaking about keeping a roof over their heads. 9 o'clock, so that you can all get home to your families. Thank you all as well for taking the time out of your evenings to come and spend with us and learn about building a forever home for cats. And last but not least, I did forget to mention there are surveys on your table, and if you could please take some time during the talk or after the talk to fill those out, because we do take that feedback seriously to keep these events improving and relevant for you in the future.
5 minutes, grab a coffee, and we'll be right back to it. Hello, everyone. If I could ask everybody to grab your seat, please. We're going to get started in about 1 minute. Thank you. Please give a warm welcome to Marian Emo.
I think I have no control over everything. Somebody's put a mic on me and controlling the mic. So I don't know. If you can't hear me, I guess you let me know or you let our friends over there know. Thank you very much for inviting us here. I really I feel like the Hamilton Burlington SPCA, we're in very auspicious company. First of all, Liz O'Brien, Dr. Liz, as we affectionately call her, was one of the first people I met when I joined the SPCA 5 years ago. And it's probably taught me just about everything else, everything I know, other than my staff who are here, who have taught me anything. And we have a wonderful partnership with public health, working in the community veterinary outreach program. And I just learned recently that Dr. Jackie Farr moved into my neighborhood. So I'm a very happy camper. Anyways, I just want to take a minute and point out some of our staff who are here and who you may want to approach with questions. First of all, and Dr. Jen, could you put up, just raise your hand? Dr. Jen Farr, who's our director of our companion animal hospital, and Karen Reicheld, who's our manager, animal care and adoptions, and Becky, our intake coordinator, and I think Lori is here. Lori, our manager of fund development. So thank you too for coming out. So I'm here to really talk about what's important to us. And there are two things that are important to us. One, it's getting cats to their forever homes, but it's also making sure that cats in our community are healthy, safe, and wanted. And what I'm going to do today is really talk about where we've come from and where we think we're going. And just like any house that you might build or any place you might be looking for a place to live, in part, you're going to be guided by what you know about your community. So we too are guided by what do we know about the community. So I'm going to talk to you a little bit about the local demography that is shaping our work and some of the trends. So who are we? We've been around since 1887. I think for many, many years now, our mantra has been rescue, rehab, and rehome animals. Our focus now is guided still by the rescue, rehab, and rehome animals, but we're guided by the 5 freedoms. We're really guided by keeping people and pets together and guided by continuous learning for best practice. So those are the things that shape our everyday work in the organization. I like this. I think you as practitioners in the community perhaps sometimes feel, who's telling us how to do the work? Who's in charge? What do people know about cats anyways? And what stake do they have in it? So kind of like this is who's making decisions about feline? And something we think about every day. So today, as I said, we're going to talk about our community, our trends, the human-animal bond, shaping our work, and how our response to these things is part of our foundation, working with others for healthy, safe, and wanted cats. What's interesting, I think, about our community, when we think about, or I came to the shelter 5 years ago, when I was learning, I was seeing surrenders coming in. And why do people surrender? And, you know, compassion fatigue can set into your shelter. And, you know, I've heard our staff and volunteers say, oh my goodness, look who's coming in to surrender a pet again. Well, there are lots of good reasons why people surrender their pets. And we decided we needed to learn, what do we know about the community we serve? And what difference will this make to the kind of service we can provide to our community? So close to 40% of the area population is 50 years plus. This is something we need to take into consideration. The demography, the socioeconomic status of those people 50 years plus is affecting our business. When we think about who's surrendering, what animals and where are at risk in the community, in part because of an aging population. And we'll talk about some of our response. What is the household earning in our community? And, you know, when I first went to the SPCA 5 years ago, and there were some very robust discussions at our board. Well, why do those people qualify for a low-cost spay neuter? Look at the people coming in. What do we know about them? Well, you can't know about everybody, but this is kind of interesting. And I used to work in the health and social service system for a number of years. You know, if you're a family of 5 and your average household income is about $45,000, you haven't got a penny left over in this city anymore. Well, one of the questions I came across in our board at the first year was, well, if you can't afford a pet, you shouldn't have a pet. Well, that may be true, but we also know really about the value, the health and wellness contributions that pets make as family members in the family. And are we really interested in being a society where we have 2 groups of people, those who can afford pets and those who can't afford pets? So where's the equity of access to pets? So this is kind of interesting. Poverty rates. So those are low-income cutoffs, but what are the poverty rates in our community? So you can see these. But what's also interesting in the poverty rates, even if we think of it as a community, no matter what sector you're working in, we look at all the programs that are there, supposedly helping to get people out of poverty. Well, it's kind of interesting. Among adults, chances of escaping poverty decreased from 44% in 1993 and go up to 2013. So people's chances of escaping a pattern of lifestyle, income, and opportunity in the community, that's changing too. And we have a number of vulnerable neighborhoods, and this slide could have been another whole presentation. But around how many here have ever heard of Code Red neighborhoods in Hamilton area? Anybody? Okay, so the Hamilton Spectator, well, right there, 2011 and 2012, devoted numbers and numbers of pages over a year and a half, 2 years to Code Red. So they did the data. Partnerships with McMaster University did a deep dive into every neighborhood in Hamilton and tried to look at what can we understand about this neighborhood. So when people say to us, Hamilton Burlington SPCA, how do you know which neighborhoods to go to find vulnerable families, vulnerable pets? Well, in part, we're guided by the demographics and we're guided by the Code Red study that was done in 2010. The profiles of these neighborhoods here, I won't read them, they're mostly in the inner city, a few of them on the mountain. And we meet with neighborhood action strategies. So every one of these neighborhoods has a community hub. They're named different things. And when you meet with them, you find out what are the issues in these communities. And that's where we find out how people are struggling in part with their pets, hoarding issues, and street cat issues. So these are some of the things that, that guide us. If people are interested, when you go back, for those of you who are interested, here are some sources that you can go to and read about those neighborhoods. So that's kind of knowing the community. If we want to be, if the Hamilton Burlington SPCA and all of us here want to be of service to community, we need to know a little bit of something about our community. The other thing we're guided by is what are the trends in animal welfare? And the trends I'm briefly going to speak to are national and North American trends that our staff will tell you we experience them every day in our shelter. So generally speaking, intake is down. For 15 years now, most pet owners are doing a better job with dogs. And so we're not full up with dogs as we may have been 10, 15, and even more years ago. That's true for kittens, for cats, but I don't want to pretend that we do not have a kitten-cat seasonal surge. It prevails and prevails still. The shelter population is gradually changing. If you have an aging population, they're living longer with their pets. When they die or they go into a long-term care home, you can be sure their pets may be older. So what does that mean when they come into our shelter because there's no one left to care for them? You have aging pets. While dog intake, for sure, the trends across North America are down in the last 15 years, what about those dogs that are coming to us? I'm not here right now talking about the puppies that come, but the other dogs, they have behavioral issues. There are aging pets and there are pets belonging to families that haven't had the resources to do preventive health care over time. So they're coming with chronic conditions and complex conditions, kind of no different than an aging population. And what are the pressure points that the health and social service system is experiencing in our community because of an aging population? So aging pets, behavioral issues, and chronic conditions. While intake is falling, no different from businesses in other sectors, costs are not. Shelter management tools. There are new shelter management tools who are helping all of us, whether we're talking about in the city pound services or in humane societies and SPCAs across the province and across Canada. There are shelter management tools. Capacity for care is one of them. But interestingly, it will talk about shorter length of stay. No, fewer pets in your care means often shorter length of stay, means healthier pets that the public sees when they come in, means they move on faster, which means you can take in animals. So it's kind of interesting what our tools are teaching us about shelter management for optimal outcomes. The other thing that's changing is the definition of difficult to place. So for many years, or certainly in the last 10, you often hear no-kill shelter. We don't use the term no-kill shelter because there are those circumstances where the most humane option is euthanasia. At the same time, every adoptable animal gets a home. But there was a time that that wasn't true. So what's changed? So Karen, you'll have to remind me the name of this. Bee. So this is Bee. Bee has 3 legs. And I remember talking to a longtime donor of the SPCA and saying, aren't we doing a little bit too much work to get these pets adopted? No, they can live healthy lives. So this is Bee, 3 legs. This is Owen, 1 eye. Sorry, we just had to put in a dog because she's so sweet. So this is a dog that came to us already like this, the front legs, came to us with a badly injured back leg. So she has a home. She's happy as heck. But these are 3 examples of, and we're not unique in the Hamilton Burlington area, but there was a time these animals would not have been considered adoptable, but they are adoptable. The human-animal bond, this too could be a presentation of length, but we got to know Michelle Lem in Ottawa, who founded something called Community Veterinary Outreach. And basically the premise of Community Veterinary Outreach is There are people well deserving of pets for whom their pet is their best friend. And one of the ways you can work towards the health and well-being of those people is also to be working with their pet. So there's a whole dynamic around One Health and One Welfare. How do we think of the relationship between the health and well-being of pets and people, both from the positive impact, but also where the risks are concerned. So community veterinary outreach is about accessible veterinary care to the people who can least afford it in our communities, but who probably benefit the most from a pet. I took a survey. It says, what kind of pet do you have? How many hours a day do you spend with your pet? How many hours a day do you socialize with your pet? A whole bunch of things. And Jen, in most instances, the near homeless person will answer all of those questions and the outcome is they spend more time with their pet, socialize their pet, and really care for their pet in ways that I can't deliver from a time perspective. So the human-animal bond is something that has also guided our work. And you may have heard this expression, which we have shamelessly stolen from Donna Jenkins at Zachary's Paws: pets and patients are a healing combination. The human-animal bond, again, go to do this. I won't read this entirely, but the question we had to ask ourselves at the shelter: should homeless people have pets? And the answer is yes, a lot of the time, not always. You still want to have a responsible owner. You want to have an owner who understands what's important about taking care of their pet. And you want to, hopefully you want to have an owner that it trusts the resources around them to help them take care of their pet. We do think, and the evidence is there to support, yes, there are homeless people who deserve to have a pet. Trending, what are we specifically about cats trending in Hamilton from our experience? And I hope it's not a whole lot different from yours. And if it is, we'd love to hear about that. There are just too many cats not fixed. There are too many lost, stray, abandoned cats living on the streets. This can, in part, and for other reasons, lead to cat hoarding. So one of the things our protection officers and Karen's team deals with a lot is cat hoarding. How do we rescue those cats? How do we re-educate the cat owners? And one of the things that we are also learning, and I don't think this would be a surprise to you, when we think about preventing cruelty to animals, and this is an oversimplification, but there can be intentional neglect and benign neglect. The outcome for the animals is just the same. So in our ways of work, we're having to deal with a huge number of clients, and they sit at different places in the continuum. Because I can tell you this, if you have a cat hoarding situation, you take away all the cats with no education and no support for that person who thought they were doing the cats a favor by bringing them in and caring for them, that household will just fill up with cats again. So cat hoarding is and sort of masquerades under cat rescue sometimes. High number of surrenders, again, think about our population demographics, think how long people are living, think how long people are isolated, think about the resources that people have to take care of their animals. Aging population and aging cats, the cost of veterinary care, and euthanasia is unaffordable. If there's time, and some of you want to talk to Karen and our team, this is a real challenge for us, because when cats are truly at the end of their life and people can't afford euthanasia, this is a problem in our community. And if we're guided by the 5 freedoms, these cats are living in pain and distress. One of the questions I will be leaving with all of us today is, what can we do as a community for that? Some of the solutions, we don't have all the answers, and we certainly can't do anything by ourselves. Every cat healthy, safe, and wanted, for sure. And I know Dr. Liz reminds all of this. What are the 3 best things we can do for our cats? Get them fixed, get them to a vet for long-term preventative care, and a microchip. And what we would add to that, support cat owners to be the pet parents they want to be. Very few pet parents don't want to be a good cat caregiver. and improve the retention rate. So isn't that interesting? Many of you will likely be familiar with shelters. You got some space, you're not full up. You go and you bring in cats from Quebec, you go to Northern Ontario, you go to your neighbor, because we built it, right? You build it, they will come. Our goal now is not so much to keep the shelter full, but to do right for what is right for the animal. And sometimes that means helping the animal stay at home, not come into the shelter so somebody else can adopt it. So quickly, some of our solutions. I just want to check in how much time I have. 10? Okay. So we offer several pathways to spay neuter, because again, going back to our demographics, not everybody can afford to get their cat fixed. So we have what we call an affordable spay neuter rate, which currently sits for cats at $75, although Karen and I and the team are looking at probably it needs to go up a little bit. We have subsidized. We've been working with PetSmart Charities of Canada. They will have subsidized by December 3,100 spay neuters for cats. When we do the math, we do the estimate how many are female, how many kittens might a female have or cause to be birthed in any 1 year. We reckon through those subsidized 3,100 that we only do registrations for in those code red neighborhoods. That we have prevented between 34,000 and 53,000 unplanned kitten births in our community. The fellow at my corner store says, well, why wouldn't you just have the kittens and adopt them out? I say, because I don't have 40,000 people lined up at my shelter to adopt kittens. It's not difficult. It's quite simple. So we have the subsidized, which is a copay. The owner has a copay, and we also have pro bono. So through the community veterinary outreach program, which some of you are familiar with, which now the Hamilton Burlington SPCA manages, we provide those health checks, and for those cats that need spay neuter, we provide that pro bono through donor support. So February this year, we marked 25,000 spay neuters, and as Thomas Gladwell says, when you do something 10,000 times and more, you just get good at it. We hope this year, we've changed our year, but this fiscal year, 5,000 spay neuters, and there's the 3,100 subsidized PetSmart. So in part of building this foundation, Get a Vet, Cat Healthy, and Microchip. We've been very fortunate to engage in relationships with our partners, and some of them are here tonight. This is what every adopted pet gets, but also we have piloted, and now these things are embedded in our practices. Get a Vet. So for all of you out there who are vets, we hope that you think of us as your partners and not as your competitors. Our staff have been trained because we learned through Royal Canin and the CVMA and through Dr. Liz. No surprise, people adopt a kitten, it's had its vaccinations, it's had its shots, it's good to go for the rest of life. We know that that's not true. So embedded in our practice is the importance of getting a vet, and also the Cat Healthy Checklist, which Dr. Liz is going to talk about. Shelters are referral sources. If we do our job well and we educate new pet owners about the importance of the continuity of care, then in fact, we are referral sources. The more animals alive and rehomed, the greater the demand for veterinarians, we think, for preventative care. Forever Home, this is another part of our foundation. We started a pilot, I think a year ago, Karen, maybe a year and a half ago, when we were seeing, numbers of cats coming in, asking the question, why are you surrendering your cat? So the outcome is we now provide ambulatory care for cats who are already in safe and loving homes, who are at risk for surrender. And while for many animals, by the time they get to a shelter, they are already in a better place. But not all animals need to be in the shelter, because they are coming from a fabulous place. So intake diversion and trauma avoidance supported by donor dollars. I'm glad my staff are here because they'll keep me honest. But one of the trigger cases, if you will, for engaging a donor to support what we call the Forever Home program is, middle-aged couple came in with a cat. in tears. They wanted to either surrender the cat or have it euthanized. The cat had severe dermatitis. They had been to a vet. They couldn't afford the vet care. But they didn't want anybody else to have the cat. So they brought us the cat. We don't, first of all, we don't euthanize anything that's treatable. We don't euthanize any animal that's, if not right now, that can be adoptable. It was dermatitis. Cat was examined, treated on site, educated as to what else was required, sent home with the appropriate creams and supports. Have I got that right, Karen? Yeah. Okay. At the end of the day, the couple who would have paid a nominal fee for euthanasia left their money behind to help that cat. That was a winning story. This was a loving home. Care was an affordability issue. And how I looked at it in the first year, why should you bring us your pet that you can't take care of? We do a good job. We get that pet ready to rehome, and you come and adopt that pet. We wanted to close that gap. So this is part of our foundation, keeping cats in the safe and loving homes that they're already in. The Home Again program. This is a fabulous program. How many of you know Zachary's Paws for Healing? Okay, yeah. So Donna Jenkins has this fabulous program, Zachary's Paws for Healing. And in essence, you can go on our website and you can read what she does. But one of the things that she does is she and her posse of volunteers foster pets, generally belonging to older, isolated individuals with few means who need to go into the hospital. Two things happen. That person will not surrender their pet. They shouldn't. They are isolated and alone. They have nobody else in the world to look after their pet. And more often than not, they'll say, I won't go in for hospital care. So Donna Jenkins fosters those pets. But some of those pets aren't in great shape either. So when our team and Donna connected, so we are now providing vet health checks and some care as required for the pets. This is a fabulous, I think, a fabulous initiative. It's also a clear demonstration that no one entity can do it by themselves. So building homes for cats requires a posse. And the partnerships for this program are, of course, Zachary Paws for Healing, the area hospitals in Hamilton, SPCA, PetSmart Charities of Canada, who gave us a small grant to help look after those cats, and Royal Canin, who provides all the food and special dietary supplements for the animals in care. And the best story of the day, the person comes home from hospital and their pet returns, and for the most part, both are healthier than when they started out. So we feel this is a very important foundational program for cats. Community veterinary outreach, I've talked a little bit about that, but we now manage a program that was managed by Shane Bateman from Guelph for community clinics and follow-ups. It's a fabulous partnership with public health, because while we're dealing with the animals, and there's Jane and or members of her team talking with the people. So I don't know, is there going to be a flu clinic at one of them? That's the plan. Okay. Again, a fabulous foundation. We are preventing intake. We are community building, supporting the human-animal bond. And we are taking care of people's best friends and sometimes only friend in their life. As we go forward, we will continue to need help. The question over time that we would like to have with vets and Dr. Liz and her colleagues, would vets lend their talent to increase spay-neuters if the services were wrapped around them? Because I know there are lots of challenges when we want to talk to vets about taking either our street cats or other cats. You've got a lot of things to pay for. If the SPCA wrapped the services around you and you came somewhere and just performed, is that of interest in our community? Euthanasia. Our pet owners need help. Euthanasia is out of reach for many, and it is leaving animals in pain and in distress at the end of life. We're not talking about euthanasia for its own sake. talking about appropriate euthanasia when it is the right thing to do at a cat's end of life. Pet parents exhaust the resources by the time they reach the SPCA. So they've gone to a vet, they've got some care, they need more care. And by the time they come to us, they've exhausted their resources. Is there any opportunity to have some dialogue to say, okay, what can we understand about this pet family when they come in, either to us or to you, and doesn't look like the few resources they have is going to amount to very much to making a difference in that pet's life. And also just a reminder to our vets, we sometimes have to say it what sounds like 10,000 times through the adoption practice or when they leave our clinic. All adopters in outpatient clinics are strongly advised to contact the shelter with any problems within 7 days of surgery or adoption. So if you see somebody come in, Becky brings in a cat to your practice, where'd you get this cat? You're a new pet owner. Oh, adopted it from the SPCA 4 days ago. Oh, was at the clinic. The first call to make is back to the clinic. We will be there to support that person. So I think there's fewer than 5 minutes left because I saw the hand go up. It's kind of the end of my presentation. Are there any question or two? I know we don't have a lot of time. Okay. If not, what I want to say is thank you. I hope you all had a fabulous Thanksgiving. This was one of my Thanksgiving wishes sent to me. So I'm really looking forward to hearing Jackie's presentation on diet and food management. By the way, it was Donna Jenkins who sent this to me. So I'm going, Donna, our cats don't look like that. Maybe some of hers do, though, that she's fostering, and they need some help with diet management before they go back home. I think that's the case. Yes, actually, that's right. Not every feral is a thin cat. So on that note, I'd like to invite Dr. Liz to come and talk about how we build some walls around this foundation of healthy, safe, and wanted cats. And
exciting. And Laura, just a reminder, what time do Jane and I finish up at for Jackie? All right. About 8 o'clock.
Okay. You have your own speaker.
I have my own speaker now.
Right.
Yeah, he promised me that he wouldn't have it on when I was in the washroom. That was my only request. It was like, Levi, please, I'm going to the bathroom now. Don't let my speaker be on, because that would be about what I would do. Anyway, really excited to be here tonight in my hometown, Hamilton, which I'm so proud that this is where Cat Healthy all started, really with our work that we did with the Hamilton Burlington SPCA in 2008, starting with the Year of the Cat. That's where the whole idea of Cat Healthy came from. So very excited about that. I'm really excited to share the stage with Jane as we raise the walls for building a forever home. And I want you to think of it that the Hamilton Burlington SPCA has laid a great foundation, lots of fabulous programs to lay the foundation, and now we're going to build the walls. And I want you to think of it as building not just a forever home for these kitty cats, but we want to go beyond that. We want to go to them having a forever home where they're understood and where their preventative health care needs and their medical care needs are met, where these kitty cats are not suffering from painful dental disease and they're not suffering from arthritis. And they're totally understood, so their environmental needs are being met as well. Because if we can meet their environmental needs, we can decrease the relinquishment to the shelter. We can get rid of some diseases like FIC for all those veterinarians, feline interstitial cystitis. So we're going to raise the walls tonight, and we're going to share what we're doing in Hamilton across the country, coast to coast to coast. And thank you, Royal Canin, for giving us this opportunity to all sit together. And I want you to look at this little picture. These are some of my patients. I get lots of pictures from clients. And that's what we're doing tonight. We're all sitting around together, table, different groups, and we're having a vision. And with that vision, we're going to build walls. And I want you to think about what kind of walls we're going to build. We're going to build walls that are strong, that are intertwined. We're all going to work to build those walls, and they're not going to be divisive. Cat Healthy, and that's who I'm representing tonight, is a Canadian initiative. And Canadians build walls that include everyone. And so the really neat thing I can tell you about Cat Healthy, and it's unique internationally really, because we often have initiatives that are veterinary initiatives, weight loss programs or shelter programs that spay and neuter your cat. We have, public health initiatives, vaccinate your cat for rabies. Great initiative going on, and you'll see what Jane's done tonight. But Cat Healthy says, you know what? Let's not all sit in our separate silos. Let's not have separate walls. Let's take those walls down and build walls that will be inclusive so we can all work together for the same cause for these kitty cats. And the real great thing about Cat Healthy is that we're wanting to work together with shelters, with industry partners such as Royal Canin, with the pet specialty stores, pet stores, with shelters, with public health. We all want the same thing. We want to decrease euthanasia rates. Euthanasia rates are dramatically decreasing across this country. Wow, we are doing a stellar job in being a very humane country, but we're still euthanizing over 20,000 adoptable cats a year. And those are just the cats that are being reported. So we know we have to decrease those rates and get these kitty cats spayed and neutered. We need to increase return to owner rates, right? Most cats, if they're lost, about only 3% in most communities will ever find their way home. Why is that? Because they're not being microchipped. And then, wow, let's get to the next level. They are being microchipped, but the contact information isn't being up to date. And I don't know if I have anyone from the shelter animal services. They know the heartache when they scan a cat. Excitement. We have a microchip number. Boom. Number out of order. Phone number out of order. Contact information not up to date. And we need to increase the preventive health care for these cats. As I said, they need to be understood. They need not to be living with painful diseases. But as Marianne said, we all have to work together. So what's neat about Cat Healthy is you have 6 board-certified Canadian specialists in Canada, and we all are working together. Sometimes it's a bit like herding cats, but we do get herded in the same room and get lots of work done. And the exciting thing is everything that you'll see from Cat Healthy, all our resources, all our tools, everything there are created by the 6 specialists and approved by the 6 specialists. So you have credible information with Cat Healthy. And I want to thank our founding sponsors. I have to mention them because like the SPCA has laid the foundation for this evening, they laid the foundation to provide a lot of the resources we have for Cat Healthy. And that would be Bayer Animal Health, Boehringer Ingelheim Animal Health, Hills Pet Nutrition Canada, and IDEX Canada. They helped get the 6 specialists all together. At that time, there were just 4 of us. Now we have 6 to create all kinds of resources. And so for veterinary teams here, go to cathealthy.ca. Send your clients to cathealthy.ca. Let Cat Healthy be their Dr. Google. There's all kinds of resources. And for the shelters as well, and I know the Hamilton Burlington SPCA, they're working, and you're going to see the great project we're doing with the help of Royal Canin. They're going to cathealthy.ca, but for shelters coast to coast to coast that might be watching this, go to cathealthy.ca. The great thing is everything the specialists are telling veterinary teams and we're telling shelters is the same as we're telling cat owners. Because the whole idea behind Cat Healthy is what we found is cat owners really, or cat parents, families, really want to know about cats. But guess what? If we don't sit grouped together, we're all giving them different messages. They'll hear something different from the shelter. Oh, we did early spay neuter. Then I couldn't believe it when I was lecturing out west. 70% of the veterinary teams in the room. I said, how many of you agree with early spay neuter? And hardly anyone put up their hands, because then the clients go to the vet and they say, oh, they shouldn't have spayed that cat early. Early spay neuter, mark my words, is sound in felines, and it's needed. We have to be part of the solution for the cat overpopulation. So with Cat Healthy, they're getting the same information at the shelter as they do at the veterinarian, as they do on the website, as they do, guess what, when they go and pick up cat litter or pet food from the pet store, from the pet nutritional specialists. So go to those resources. So what I really want to talk about is this fun initiative, and I want to encourage other shelters across the country to pick up on this project. This is called Teaming Up for Cats. And this was when Royal Canin came on board. And as I said, we have founding sponsors, but Cat Healthy is all about rising tides raise all boats, and we want to make a difference for cats. So Royal Canin came on board, and we said, you know what, we've got lots of resources for the vets, but our idea is not just to be a veterinary initiative, it's to be shelter and pet retail and in the municipalities. And we said, we really want, and they said, shelters are important to us, cats are important to us, let's see what we can create to make a difference in the shelters. And one thing, I think Marion mentioned it, and everyone in this room knows it, when kitty cats are adopted from the shelter, people, regardless of what all the shelter teams tell them, think they're all done, right? They spayed them, they vaccinated them, they dewormed them. Wow, they've got a microchip, pet insurance, they're all done. And you know, over and over, the Hamilton Burlington SPCA and other shelters have said to me, Liz, we tell them they need to see a vet, but it wasn't enough. So the actual specialists got together on wish list and said, we want a checklist. One that's going to check off what these cats have had in the shelter, and one based on the preventative healthcare protocols, the cat healthy ones are going to say what that cat continues to need and what it needs moving forward. And that's how we started with the checklist. And we also said, we did a lot of training with 3 pilot projects, Hamilton Burlington SPCA being the first, and very, very proud because OVMA decided that they had their choice of shelters to pick across Ontario, and it was not because I was in Hamilton. It was, they felt that the Hamilton Burlington SPCA were doing a stellar job, and it's something we need to be proud about in this community, and that they were the ones to host the first pilot project. So the idea, Cat Healthy Specialists, thanks to Royal Canin, created this checklist. And you know what? And we based it on the preventative healthcare protocols. And then we took this checklist to the Hamilton Burlington SPCA and said, we're going to teach you how to work with it. We're going to provide education. We're going to create what we said were cat healthy adoption specialists. So the team members from the Hamilton Burlington SPCA were educated about what those cats needed, that they could adopt them out and have very frank discussions with these new families adopting these cats. And we had some cat healthy of the infographics around the shelter as well. And their first question that the cat healthy adoption specialists at the shelter were asking these new cat families were, do you have a veterinarian? Who's your veterinarian? And initiating that conversation. And you'll see in the stats, 78% of people in that first pilot project right off the bat said, we have a veterinarian, this is who it is. And veterinary teams, you probably haven't seen them in 15 years. You don't even, you know what? You see that. You've been in practice like me. You're at the grocery store. Oh, you know what? We should bring our cat in. He's 18. You spayed and neutered him, right? Right? Dr. Little talks about in vet medicine, in feline medicine, in dog medicine, you have cradle and yearly to grave. In feline medicine, we have cradle and grave. And because of the great work the shelters are doing, sending them out already spayed and neutered, we nearly have lost the cradle part, and we're just not having much fun in feline medicine, right? It's all at the grave. So that, do you have a veterinarian, was quite interesting. They also had information on travel tips for stress-free visit to the veterinarian, and the kitty cats, they went through the checklist with these kitty cats. So let's look at the checklist when it's filled in and how effective we found it has been. And we've done 2 other pilot projects. We found in the one pilot project, 93% of people said, this is who our vet is. And when the shelter gets that information, and many of you have been receiving these emails, I think it was faxes at first, now it's emails, on Teaming Up for Cats for 3 years now. What the shelter does is when they choose a veterinarian, they send the medical records to you. So you know you have a new patient and they have chosen you. So what do they do with this checklist? And it's, you know, before kitty cats would be at the shelter and it would check off, yes, we had an FVRCP, and then he had a second. We have a veterinarian, thank goodness, Dr. Jen Farr, and very gifted gang. If you want to watch someone spay and neuter a cat, wow, or do lots of other surgeries, fabulous. So anyway, you know what? So rabies at 12 weeks of age, and Jane's going to talk a lot about rabies and our epidemic. It is serious. But then what they've done is highlighted, based on the protocols, what these kitty cats still need. So feline leukemia is still considered quite it's really a non-core vaccine except in kittens and except in young cats. All kittens should be vaccinated for feline leukemia. Most shelters across the country don't vaccinate for feline leukemia. No problem. Just highlight that that cat, based on the protocol, needs feline leukemia. Some shelters won't have a vet, but they know that that cat needs a rabies vaccination. They would highlight that that cat needs a rabies vaccine. According to the protocols, and our protocols are based on international protocols. We didn't recreate a wheel. We took everything out there and made it specific for Canada and what was useful for our country. FBRCP, guys, these kitty cats need their final FBRCP vaccine after 16 weeks, closer to 20. So when someone's adopting a kitten out at 12 weeks of age or 10 weeks of age, it may not have had a rabies vaccine. It certainly wouldn't have had its final FBRCP, and it probably won't have feline leukemia, okay? So they highlight what they need. Same with FIV testing. Was he tested? No, should be done. Same with, we had sent them with fecal containers. Same with deworming, and we've changed that in the new checklist. It's a better job at deworming. And what happened where these were then faxed, these records, to whoever the veterinarian was. This is just, I wish I had the whole year, and actually 3 years we've been doing this, but this is the first 3 months. What we found were 78% of people, as I said, selected a veterinarian. No steering, they just said this is who it is. 37% of cats visited the vet that they chose within 2 months. Now, interesting, the Americans did a similar pilot project on getting cats from the shelter to the vet. What they did differently, it was a free visit. Free everything for that first visit. We didn't. You know what? We, just like there should be no free kittens, veterinary medicine, we deserve to be valued. What we do, we're educated, it's a lot of work, it's great expense, so we didn't do a freebie. In the States, it was 25% free went to the vet. We had 37% went for ours. Now, what I can tell you, being part of this project, there are clinics here, when I look at the stats, that had nearly 100% compliance, including ours. You know, because I was behind it, come on team, let's go, right? But there were a number of clinics that had nearly 100% compliance. And there were clinics that didn't have very much compliance. And they were probably like some of my colleague friends that are probably here tonight that said, when I'm talking over coffee, all excited, oh, was that what that fax was for? Oh yeah, I remember that meeting, okay? So, and what we have found though, is those, that this program has continued. As Marion said, it's embedded in what the Hamilton Burlington SPCA do. And the other really cool thing, we weren't very long into this program, and I got a phone call. Could we send the medical records out for dogs? We don't have a checklist for dogs, but could we ask the same question? And we were like, yes. You know what? Cats rule, dogs rule, but the cats set the role on this one. So really exciting. So I'm here to just tell you about the program, how exciting it is. I've been doing this for 33 years, hence the gray hair. You know what? Before this program, I never saw kitty cats from the shelter, or rarely. And when I did, people would come in, we just wanted him checked, but he's been vaccinated, he's all done. We now routinely have clients coming in with their checklist, and they're saying to me, we know he's due for a vaccine and a deworming and a blood test. Can you do the blood test today? Or, we know he's due for a blood test, but we just adopted him and he needs this and he needs that. Could we wait till next month to do that blood test? I don't even have to talk about feline leukemia testing. The shelter has built the foundation, and now I can build the walls. It's brilliant. And how it worked, I would tell you, if you want to get that 100% compliance, as some clinics have had, assign a cat healthy clinic champion. Every clinic should have one, and we did. Kim was ours for this particular program. She's at the back, you can wave. And, 10, okay, I better get moving here. And our other receptionist, Jen, at the other, you know what, when those emails came in, they had a separate area. And they waited for about a week, and many clients booked. But those that didn't, they followed up on that and phoned them. And we used the preventive healthcare protocols, and we just embrace that you're going to have a new type of cat client coming to you from the shelter. They're educated and they're confident. One thing I think is really important if we're building this forever home and keeping these kitty cats in the home, that people do understand the cat. They do understand the feline. And Jackie's going to talk a lot about how we can feed them and, you know, put the hunt back in mealtime and all those things. But I just want to talk briefly, look at think about cats. They're not inherently social. They're very territorial. So what do? We say, you know what, we thought our cat needed a buddy, so we brought two more in, and we put them in this home with lots of cats. Just remember that cats, when we talk about their environmental needs, they're not inherently social. They'll choose their friends, but they don't always. They're solo hunters, okay? And Jackie's going to talk about individually feeding them. They don't want to feed together. They don't do that. We see that in our colony cats, but you know what? That's because there's a food source one. Cats need individual food bowls and all of those things. They're really sensitive to sound and scent. So in the shelters, remember that. Remember that they're sensitive to these sounds. If we can have little hideaways, little beds, corunda beds, all those things. And remember that in the clinics, how you treat them when they come in, and as well how you're handling them. And as I said, Jackie's going to put a lot of time into, they hunt for food and they hunt for fun. Understand your cat client. 58% of them hate bringing their cats to us, so we got to do a better job at having them like the experience. And the shelter, we know part of that experience that they hate is bringing the cat to the vet. Well, the shelter's already sent them home with tips to help us, okay? So remember that. 38% find it stressful just thinking about bringing their cat in, okay? So remember that when they're coming in, you want them to have a great experience. And I'm going to just tell you they're confident and they're like their cat. And I'm going to spend maybe about 5 extra minutes of your time because I got to share this story. Do we have some PNAs here? Okay, so PNAs, Pet Nutritional Advocates. Okay, so when I said about Royal Canin helping us with the shelter and getting into all the different sectors, we had 2 cat healthy takeovers of PetSmarts. Okay, and we had specialists in different ones and the PNAs and all of them. And our idea was to educate cat owners. So I built this great big, with my help of my husband, this great little booth of climbers and blah, 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 blah. One thing I can tell you, I could find only 1 feeding puzzle at the PetSmart I was in, which was disgraceful. But anyway, and people were invited. I'm the cat specialist. Come ask Dr. O'Brien about your cat. This is what they did. If my booth was there, they didn't want anything to do with me. My cat's fine. My cat's fine, right? They'd come up and ask me about the dog. Well, that's nearly malpractice. Sorry, I can't answer that. But, so I had to chase people around the store. People that had cat food and whatever, I'd chase them around the store and litter. And I literally did that. And you know, and I would say, oh, you have a cat? Oh, I'm the specialist. No, he's fine. So I'd have to say, what color is your cat? How many do you have? What are their names? Finally, breaking that ice. Cat owners are like that. So when we talk about compliance, just expect, when you say he needs a dental, let's say no. You have to have the whole team on board, okay? And this is one area when the shelter's already built that foundation for us, they've already said, this is what your cat needs based on the cat healthy protocols. We are already partway there, okay? So they're very confident and they're like their cat. You gotta win them over. Once you win them over, and my team can attest to this, they want to come in for tea, they want to talk, they're like, they won't get off your lap, but you have to win them over. So again, improve the experience. Get gabapentin, gang, for your fearful cats coming in. 100 milligrams, 2 hours before traveling is a godsend. Using Feel-Away, having a quiet cat room, all those things. And if you can, become a cat-friendly practice. And use your appointment as an education opportunity. That's what the shelter's doing for us. they're using their appointments when they're adopting cats out as an educative opportunity. Use it as an educative opportunity. And talk to the clients about the environmental needs of cats. Remember, they need to be understood. We need to do more than just vaccinate and deworm and spay, neuter, etc. We need to start educating clients about what the cat needs, about the number of litter boxes, about scratching posts, the need to scratch, about playtime. All of those things. Use every opportunity, because if we can build this home where they're understood, we're gonna stop. We're going to really decrease relinquishment to the shelters. We're going to really make a difference in the quality of the life of every one of our feline patients. And you know what? In vet medicine and in shelter medicine, what are we proud of? We're proud that we talk about quality of life. It's not length of life, it's quality of life. We can really make a difference. So playtime is an environmental need of these cats. So a couple of closing thoughts on building this wall, maybe taking down some walls that are divisive right now, and building a wall where we can work with our shelter in our community, we can work with public health, we can work with animal services, we can work with the local pet stores to say, hey, these are the kinds of carriers that are really best for our cats. Let's look at that. So in all of this, I want everyone to kind of think, I'm here tonight and it's lots of fun, and if you're being Skyped in from across the country, what can I do to make a difference to all the cats in my community? Because Cat Healthy is really about all cats. So how can I decrease feline euthanasia rates? Obviously we're going to promote spay neuter, but maybe I can say, hey, when that cat comes in with this checklist, darn, I'm proud of our shelter for spaying and neutering that cat. They're part of the solution. They're making a difference. Maybe we can decrease euthanasia rates by teaching the clients about the environmental needs, so their needs are met, so they're not having behavioral problems. What about return to owner rates? Gang, even tomorrow, like we've started this at our clinic, scanning every cat that comes in, making sure their contact information is up to date for their microchip. You know what? It's just one cat at a time, but we can do it. You know what? How do I improve quality of life? For shelters across the country that are watching, get the checklist, and educate your team on how to use it and implement it in your community. We've done it here in Hamilton. You know what? For vet teams, have cat champions, right? Participate in the trap, neuter, return, vaccinate programs. As Marion said, maybe it's the shelter providing the resources, so we just go for an afternoon and spay cats. That would be kind of fun. Community vet outreach programs, volunteer. See how these marginalized people, it built that human-animal bond. So there's so many things that we can do. And people say, yeah, it's a big problem, right? Cats and their care and the overpopulation crisis is a big problem. But you know what? We just have to do it a cat at a time. And so just think tonight, hey, what difference could I make in my community? Or if you're watching from a different community, how could I implement this in my community? And I just want to end, because sometimes it's overwhelming. And in the Cat Healthy journey, in my journey of 33 years of feline medicine, it can be overwhelming. But I heard a story once, and it was about a grandfather and his grandson walking along a beach, and a rogue wave came up, and it washed up on the beach. And all these starfishes were stranded. And the wave went out, and they're stranded. They're going to die if they don't get back in the ocean. And the grandfather says to the grandson, quick, start throwing those cats back in. Start throwing those cats on my mind. Throwing those starfish back in. And they're throwing them in back to the ocean. And finally the grandson says, Grandpa, we're not making a difference. Like, look at the number of them. And he said, we're making a difference for the ones we get back in the water. Okay? So every feline patient you have, make a difference. Every cat that we can spay, we've made a difference. Every cat that we can provide a home, a forever home where they're understood and cared for, where we've built those walls, where we can make sure they're prevented against rabies. On that note, I will give it up to Jane. We can make a difference. So thanks tonight, and thanks for Royal Canin for coming on board and building a community. Very proud. Jackie said she can take some of your time.
Or I'm going to stand up even taller so you can see me.
You have 25 minutes.
Okay. So, if you're not aware, Hamilton currently has a rabies outbreak. It is the raccoon strain of rabies. It all started back December 2015. Our animal services got a call that there were two adorable bull mastiffs at large. They went and picked them up. At the same time, the officer had in the truck a sick raccoon. Unfortunately, I think it was Satan, one of them was called, was an excellent cage escaper, escaped out of its cage and then ate through the cage that the raccoon was in. Raccoon scratched the dog, therefore raccoon had to go for testing so we could eliminate any risk to that dog for rabies, and sure enough came back positive. First time ever raccoon strain in the Golden Horseshoe area, first time in 20 years for a terrestrial rabies strain. How did we get it? It was a translocated animal. We're not sure if it was ship, rail, or truck. Not that one. And it came from close to Vermont. They are able to type the strain, and it's not Western New York where everyone automatically thought it came across. But the Ministry of Natural Resources does a great job every year of baiting that border to keep it from crossing in. But unfortunately, when a truck brings it in and lets it loose in Hamilton, doesn't matter how much they bait that border. So this is our current picture. 303 since the outbreak started. That's the breakdown of species. The two cats were stray cats. We also had a skunk that had that strain, not included in that total. All of Ontario for this outbreak, because it's not just the Hamilton Health Unit that's affected by this outbreak, it's our surrounding areas as well. 429 cases. So we're winning because we have more. But also we have the fox strain that's in the Perth, Huron area. Waterloo is joined the party, and Guelph. So there's 20 of the fox strain circulating there. That's kind of a map to show you what the ministry has done for surveillance-wise. So the red diamonds up there, those are the fox strain. The purpley blue are the raccoon rabies strain, and the green are just animals that have been sent for testing that come back negative. So we all know it is the law to vaccinate your animals for rabies. That's cats, dogs, and ferrets, 3 months of age. But new to this year, livestock got it added in. Some health units had livestock as part of their bylaws. It's now across the board, all of Ontario. But with the caveat that it's only horses, cows, and sheep, because they're on label, and only those animals that would come in contact with the general public. So a riding stable that gives lessons, absolutely has to vaccinate the horse. So who does rabies testing? Well, local public health does it when it's a human potentially exposed to the virus. OMAFRA, who you guys are probably familiar with, they do it when a domestic has been exposed to wildlife. The Ministry of Natural Resources is doing it when an outbreak occurs. So it's considered surveillance testing, and that's only when we've eliminated any human risk or any domestic risk. And then new, last year, we also have the Canadian Wildlife Health Cooperative that is testing any wildlife, and stray cats are included under that, in areas where surveillance testing is not taking place. So remember back December 2015, that was December 4th. December 3rd, we had no rabies, we thought, in a terrestrial animal. If we had a raccoon that was behaving strangely and needed tested, there's no human exposure, no domestic, sorry, I can't test it. It's probably just distemper, don't worry about it. Now, those health units in other areas of Ontario have an option. When they have wildlife, including stray cats, that are exhibiting symptoms of rabies, and they want to find out, is this circulating in our community? Now there's an option for health units to send that for testing. Just some magnets. I dropped these off at all our vets' offices here who will take them. Just tells you who to call. So for public health, we investigate all bites, scratches, or potential exposure to saliva when it's reported to us. There's only 2 ways we can eliminate risk to a human. And a domestic cat, dog, and even livestock, we can do a confinement period, observation period. It's not called a quarantine. A cat, dog, or ferret would start to show symptoms within 10 days of being infectious and die. So when we get a bite report, we see that animal at the beginning, we see the animal at the end, no symptoms, still alive and well, no risk to that human. The other way is to send it for testing. Obviously, we're not sending pets for testing. We're all going to do the observation, but sometimes we have wildlife exposure, bats, obviously, or the animal has bitten someone. This probably happens in your clinics a lot, bitten someone and then due to health reasons has to be euthanized. It's inhumane to keep them alive. We can now no longer monitor that animal for 10 days, so therefore we'll send it for testing. PEP is recommended when we cannot eliminate that risk. So at the end of that observation confinement period, the animal is determined to be free of rabies. True or false? Hands up if you think true. That is false. All it is eliminated is that person that was bit on that day is not at any risk. That animal can still be incubating that virus and start to show symptoms a month later. So OMAFRA, they also do rabies testing. So this would happen a lot in your clinics and your situations where they brought in their pet and that pet has been exposed to, say, a bat or a skunk or a raccoon, and now that animal needs to go for testing. So OMAFRA will test that wildlife for you if we have it. That's the important thing, is that those are reported to OMAFRA immediately. They request that all animals, domestic animals that are exposed to wildlife or potentially rabid wildlife, have a booster shot within 7 days of that exposure. That's regardless of their vaccine status. So up to date or not, a booster with 7 days. The equivalent would be if I had my pre-exposure and I was then also exposed to, say, a bat, even though I have antibodies in me, ministry still says 2 booster shots for you. Just need to bump that up just in case. Same with the pet. This is kind of what shows you how long that their confinement period is much more strict than ours. So if that animal is not boosted, it can range from 45 days up to 6 months that that animal is under a confinement. And for a cat, that has to be kept in a crate for 6 months with one person feeding it and no interaction with the family. That is not fair to that animal. And indoor cats are at a high risk for rabies, higher than anything else, because especially in Hamilton, we have a high bat population. And we call August bat season because public health gets about 400 calls in that month of bats coming into homes. And usually the first family member that knows that that bat's in there is the cat. So like I said, MNRF does our surveillance. So right now, because we are in an outbreak, weekly they're picking up samples from our animal services, who we would be lost without. They answer all the calls that come in from the public when there's a sick, strange, or dead wildlife on someone's property or near their property. They go pick that up. It then goes to the Ministry of Natural Resources for preliminary testing. This is so we don't bombard CFIA with a ton of negative specimens, because their priority is public health safety. So they do their direct rapid immunohistochemical testing, which is pretty much 99.9% right on par with the FAT testing that CFIA does. So I'm going to give you a little warning. I'm going to show a graphic picture, but you guys are probably used to this. I love this picture. That is how they take the sample for rabies from the brain, which I thought was cool because I assumed they went through the top of the head. They do not. They need the brain stem. So any positives that they receive, the ministry then go off to CFIA, and then we get those weekly notifications of how many positives. At the height of our outbreak, we were getting 5 to 9 positive animals on average per week. Now we're down to 1 to 2, and some weeks none, sometimes 2 weeks none. We've got to go a whole month with none yet, though. That raccoon there is an actual picture taken by Animal Services that got a call. That raccoon just died right there at that fence. He could have walked around, but nope, that's where he chose, and I put money on it with Animal Services that that's going to come back positive, and he's like, I'm not taking that back because I think it's going to be positive too. So, and sure enough, it was positive. So just an example of odd behavior of an animal just dying at the fence like that. So how quickly symptoms can occur. So our second positive stray cat. Was seen in the Glenbrook area here, given food and water, was quite friendly. This was on someone's property, this stray. Fed it, looked fine. Next day, cat's back again. Still ate, again, still friendly, but this person was worried this animal's going to get hit by a car. I need to take it into animal services. So they brought it in. It was triaged. Everyone thought it was a really friendly cat, probably newly discarded or at least once homed because it was so friendly. No signs of real illness, still eating and drinking. That was on the Monday. On the Tuesday, it had some upper respiratory and some spotting in the cage, so they thought urinary tract infection. Again, still eating and quite friendly. Went to the vets for a checkup. Started to get a little more agitated, not wanting to sit down that day. But by the next day, by that afternoon, full-blown aggression, very vocal meowing. When the officer went to go pick it up, because we were just going to hold it for the 10 days, she's like, I'm not taking this back to animal services. It's definitely acting like those raccoons that I pick up every day. And so sure enough, we euthanized and it came back positive. But so quickly, less than 2 days, eating, drinking, friendly, no signs of any illness besides maybe, like I said, the urinary tract and the upper respiratory started to come through, and then all of a sudden, full onset. So the risk is real. This is just an example. I won't read it all to you, but kind of the gist of it is that someone had reported back in 1986, I know that's a long time ago now, that their animal had interaction with a fox. Never was reported to OMAFRA, even though the vet did tell the person, you should quarantine the animal, but we know that pet owners don't always listen. So they ended up trying to adopt out all these puppies. Some of them went to a nursing home for them to try and find people. At the end of it all, 134 people required PET because of exposure, because 2 of the puppies did test positive for rabies. So it can happen. So I thought I'd share just some real life cases of what you might see in your clinic, and I apologize for the dogs in here too, because they can get rabies as well. So case number 1, a skunk versus a dog. So this dog was out in its backyard. Owner tried to call it in. It was an elderly dog that was not well to begin with. Dog would not get up. Owner realizes there's a skunk gnawing on his dog's leg. So he goes out there and kicks at the skunk. The skunk would not stop gnawing on the dog's leg. Just so you know, skunks don't normally eat dogs, and I'm sure you guys are aware. So he starts dragging his dog to his house while the skunk is still attached, and gets to his door where he does another kick. This time the skunk lets loose. He gets the dog in the door. He then cleans the dog's wounds with his bare hands. And then he takes the dog to the vet, to which the vet said, no, you gotta hold this dog for 10 days because it could be exposed to rabies. That's the rule with public health. Well, that is the rule when that dog has bitten a human and we need to eliminate the risk of the human. It's not the rule if the dog is at risk of getting rabies and the owner wants to euthanize because this dog should have been already euthanized due to its illness. We're now preventing that dog from going through that potential exposure to rabies, as well as the cost that it's going to incur and the potential risk to that owner who's now going to live with that animal during that time. So that was I had to call the next day and smooth it over, and he was able to take it back, but he still got the bill for the antibiotics and all the other things that he took home for the dog that he shouldn't have had to. So when there's no human bite or scratch to an animal, we do not need to do it for 10 days. If the animal needs to be euthanized because of whatever situation and there's an attack from wildlife, you can euthanize the animal. Case number 2, dog and raccoon got into a fight. Dog was scratched on the muzzle. He took the dog to the vet. Antibiotics were prescribed. No further action. So again, this is a case just like the foxes with the puppies. That needs to be reported to OMAFRA, and they need to do their risk assessment. And then hopefully we still have the raccoon that we can send for testing to eliminate the risk. If we don't, then that animal will go under a confinement period based on their criteria. But it's not just antibiotics and send that animal home. Cat versus bat. We get tons of these. All I deal with is domestics and wildlife in my role right now. So like I said, August, I one day had 5 cat versus bats that I had to deal with. And one day, 5 just coming through. What about the ones that don't call through, right? So the cat killed the bat. The owner was told, no worries, cat's up to date. So they threw away the bat. Oops, sorry. So that cat, because we couldn't eliminate the risk, had to go under a 3-month observation period because it was up to date, luckily, but we couldn't eliminate any risk to the exposure of the virus. So some things to remember when you are having an animal that is going to go for testing. So before euthanizing or vaccinating any animal, you need to be asking that question: has it bitten or scratched anyone within 10 days? Reporting those exposures to OMAFRA or to public health, and then preserving the samples in the fridge or freezer with the neck extended and paws against the chest. And then you can't cremate the body until those results come in case it is positive for rabies, because there's different requirements for that. So just some scenarios for your clinic. Client calls in saying their cat's walking strange, won't eat or drink, drooling, constant meowing. Ask client if they're aware of any exposures in the last 6 months. Have client crate the cat immediately and avoid any direct contact. Have the client come into your clinic ASAP, but you want to make sure you're isolating that animal from other animals. And then ensure no staff has any direct contact with that cat, so gloves at all times. And then contact public health for consult. And I work with all of our vets when they have suspect cases to do that risk assessment and help them get that animal tested. But then there's other scenarios. So a new client brings a cat in for an appointment, cat scratches an RVT during an exam. I know this never happens though. Scratch is not reported to public health because it never happens. And then 5 days later, that cat starts to show some neurological symptoms. But the owner takes it to a 24-hour clinic because this is at night now and their vet's not open. Cat ends up being euthanized due to health. The vet at the 24-hour clinic suspects possible rabies, reports it to public health, cat sent for testing, but no human exposure. So those results can take up to 2 months to come back. In the meantime, your RVT is never made aware of what's going on. So I know that if you reported every scratch, you'd be sitting at the fax machine every day, but keep in mind that this is a scenario that definitely could happen. So our valuable partnerships, sitting over in the chairs there, my colleagues. Dr. Liz has attended almost every one of our low-cost clinics. Hamilton never had low-cost options before, and then luckily enough, we got a bunch of vets that were willing to participate. So we do an external rabies clinic twice a year, one at Gage Park, which just took place at the end of September, and we vaccinated 103 pets at that clinic. Our first one was 363 in the rain. Yes, it wasn't fun. Also, internal rabies clinics. We have a vet that offers low-cost vaccinations in their clinic 7 days a week. Then we have the voucher program through public health. So that's when I go out to investigate a dog bite, animal's not vaccinated. After that 10 days, they have 2 weeks to vaccinate. I see how that person's living. They say, can I have an extension? I give them an extension. And then they say, can I have another extension? Like, I really can't afford this. Well, I can give them that voucher then, because I visually can see the situation they're in. And giving them a fine is not going to help vaccinate that pet. So we give them the voucher. There's 12 vets locally that are on the program now. The owner of the pet gets to pick which vet they want to go to. They make the arrangements, and for $25, their pet's vaccinated. We have our awareness campaigns, if anyone has seen it. New to this year is the PurPup. We have lots of resources in that, so if any clinics want resources, I will provide those to you. It was also used by OAVT last year and this year for their Protect Your Pet campaign. We have activity books on rabies. We have a short video, and we have a longer animated video. All of these are available, so if you want to play them in your clinic on your TVs, I can set you up with them on USB and away you can go with them. So some lessons learned. Lack of wounds noted on a lot of the positive animals. Most common symptoms were the difficulty walking and the vocalization, and the not eating and drinking in the ones that we were able to observe that. And how quickly symptoms can present. And a large portion of the wildlife that is tested positive for rabies, and when I say large, over 95% also had distemper. So when you think an animal in the wild, when you see a raccoon and you have the crusty eyes and you think for sure this is distemper in this animal, that's why it's behaving that way, it doesn't mean that it doesn't also have rabies. We had one animal that had rabies, distemper, and parvo though. He had the trifecta. But like I said, a large portion have both distemper and rabies. And then also something we learned after our first rabid stray cat is to take photos of those cats before we send it for testing. This is a stray that's out in the community. We have no idea who's had any exposure to it. And then now, once we find out it's positive, we need to show pictures, and just the head is not really likely to show. So that's the end of my presentation. I don't know if I have time for questions, but if there are any, I will take them.
That you do the use education, educated materials to let people know that there are other vaccinations.
Yeah, so we hand out like
dogs need.
healthcare of like after the vaccination. We make sure that they understand this is not this animal is not getting an exam. That this is strictly a rabies vaccine. We hand out the Cat Healthy. We also have a dog version. That
yeah.
Who helped us create that?
Maybe it wasn't.
It wasn't you, I know.
It might have been. It might have been.
Yeah, so
sorry if I have something wrong, guys.
We do hand out lots of information on that, and then we also hand out the contact cards of the vets that have actually vaccinated, because a large portion of the people that come to our clinic don't have a regular vet. We do ask that question in our registration. So now we're hoping to build partnerships with that person that needs a vet. Even though they needed the low-cost vaccine, doesn't mean that in the future when they need vet care, they aren't going to be looking for a vet in the community. And so we want them to recognize the vets that do that great work for us. So thank you very much. I'm now going to have Dr. Jackie Parr come up here.
Going the wrong way. I definitely do not want to cover rabies. So I'm here to just focus on the nutrition piece. So we've had the opportunity to lay the foundation with Marion. Dr. Liz and Jane have worked on building the walls. And now our goal is to have happy, healthy cats. So we're putting a roof over their heads, with the goal being that we keep them in their forever homes. And in light of this grand occasion, I did put my Smart Cat shirt on. For those of you who are watching across Canada, it's cats with glasses, because it's the only way to show how smart they are, right? They're like little geniuses walking around your household. So I do have a couple of quick disclaimers that I always like to point out. So in addition to being a board-certified veterinary clinical nutritionist for Royal Canin, I'm also an adjunct professor at the Ontario Veterinary College. As a bit of trivia, how many board-certified clinical nutritionists are there in Canada? Yes, in the back. Good guess, 5. There's only, oh, did someone say 6? 6 feline, and there are 5 of the board-certified clinical nutritionists. So as you can see, the first one to get the double digits is going to be the winner. So I'm also involved in the American Academy of Veterinary Nutrition. I'm the website director, and I'm also the owner of my own small company called On Par Nutrition, and that's where I wear my alternate superhero persona, the Kibble Queen. I do also really love wet food, but pate queen, chunks and gravy queen, it just does not have the same ring to it, so I went with the Kibble Queen. I've got a couple of beautiful kitties up on the slide here. The top photo is a lovely little female kitten who's having a nap in a salad bowl. She was trying to help her mom make dinner, which resulted in her mom having to wash the salad bowl. But we are going to talk about how do we set kittens up for success through nutrition. We also have on the top screen there a healthy adult cat, and you've already seen these kitties. Dr. Anne-Marie Germain, who's here tonight with us, this is one of her babies, and yes, that is a cat doing agility. So this is our healthy adult cat, and this is what we want to talk about. How can we keep them healthy and active in their homes? Unfortunately, we do have a situation where we have lots of animals that are being overfed, and we are at an epidemic. We talked about a rabies epidemic, but we are having an obesity epidemic in our domestic cats. The last numbers from the Association for the Prevention of Pet Obesity said almost 60% of cats are overweight or obese. So yes, that is an epidemic. And what we want to talk about today is how do we prevent that? Because these animals can be surrendered. And I'm actually going to show you the case of a cat that was surrendered because through her obesity, she was not able to get into the litter box to go to the bathroom. She wasn't grooming well anymore. And she ended up being surrendered not once, but twice. And what ended up happening was through a successful weight loss program, she found her forever home. And then the last case here is our goal. It's to get a healthy, happy senior cat. Remember that age is not a disease. It's something that happens very naturally. And so we want to also keep them healthy throughout their senior years. And there's a lot of things that we can do through diet to keep them healthy and happy. So I do need to bring up a couple of sets of guidelines here as we move through how to approach feeding cats and kittens. For those of you who are in the room tonight, we've got some great proceedings on your tables if you want to follow along. For those of you who are watching online, we will absolutely share these proceedings with you when we are finished. So we're going to cover both the World Small Animal Veterinary Association and the AAHA guidelines for nutritional assessment. So you're thinking, well, what is a nutritional assessment? A nutritional assessment is really the tool that helps us answer what is the best diet for this cat. So as a nutritionist, my tool is a nutritional assessment. For someone who's a surgeon, their tool is a scalpel. We just use different things to answer very common questions. You may have heard of nutrition referred to as the 5th vital assessment. And of course, in my heart, it is number 1. But there were 4 really good vital assessments that existed before nutrition came along and got its role there. So of course, temperature should be assessed in all of our patients, heart rate and heart function, respiratory rate and lung function. Pain is incredibly important to assess in our feline patients. And then, of course, nutrition. Does anybody know what the 6th vital assessment is? It was named quite recently. Dentistry, an oral exam for every cat patient. So all of these things are critical. Now my intern mate, so I did an internship in downtown Boston at Angel Animal Medical Center, and my intern mates used to make fun of me because even as an emergency intern, I made sure that every animal got a nutritional assessment. So I was by no means the fastest intern. I was not the slowest, but if an animal came in for a broken toenail and it was not up to date on rabies, it did get a vaccine, and if no one had told them that their pet needed to lose weight, I had to spend the time doing it because I was not doing my nutritional assessment otherwise. So broken toenail resulted in referral to general medicine for a weight loss program. Now, the really neat thing about the nutritional assessment is it's not just the food that goes into the kitten or the cat's mouth. We take into consideration everything because this is really important when it comes to developing a good nutrition plan. So we've got our diet factors, and so that could be everything to do with their dry food, their canned food. Are they going outdoors and potentially hunting? They could be hunting just for fun, or they could be eating some of what they've actually captured. We also have our patient factors. So do we have a growing kitten? That's a very critical life stage when it comes to nutrition. Or do we have an adult animal that's been healthy for most of its life? Potentially, do we have an animal that's starting to become overweight? All of these things we need to take into consideration. And then one of the areas where I've found through some of my client interactions that things can often fall apart is if we don't take into consideration the environment and the feeding management. One of the big things that plays a huge role in feeding cats is it a multi-cat household? Because usually once you get 1 cat, you get 6, right? So they just sort of multiply because you realize how much you love them. And as a result, if we don't take that into consideration, our feeding plans are often going to fail. Now, within the proceedings that we're going to be sharing with you, there is a checklist, and I've really adapted this checklist from the one that Wasava put out to include some factors that the shelter would need to consider as well. So things like inappropriate housing, whether or not the animal really had access to regular food. But we'll go through these in a little bit of detail just so that you can familiarize yourself with them. So at the top of the list, we've definitely got our animal factors. So I've already mentioned life stage. So is it a growing animal or is it an adult animal? Potentially, is it an animal that was previously stray and is now pregnant or has a litter of kittens? These are all things to take into consideration. We want to do a good physical exam, and through that physical exam, we can figure out, does the animal have a normal body condition? So we're going to focus in on that, or do they have any abnormalities in their muscle? And I'm going to show you some great tools for evaluating muscle condition as we go through the lecture. Some of the other things that we may want to focus on could be potentially starvation, or if they were housed, have they potentially become ill and they're now anorexic, or which means no food intake, or hyporexic, which means they're not eating enough food to meet their needs. In addition to that, we of course always want to focus on GI function. We always have to ask cat owners about hairballs, right? Because there's this myth out there that hairballs are normal. Well, hairballs are a form of vomiting. They're definitely not normal. So this is something that if the animal is owned, we definitely want to find out about hairballs, because maybe it's that the nutrients in their diet are not appropriate, or their diet's not balanced and their hair coat is very poor. And so the animal's ingesting a lot of extra hair as they're grooming. Maybe they have some sort of GI disease that we need to actually take a look at. So hairballs are a critically important question for cats. And of course, any other medical conditions or medications that the pet may be receiving. When it comes to diet, lots of things to focus here, but I want to give you a question that can be very helpful if the pet is living in a home. Asking them to tell you everything that Joey eats from first thing in the morning up until you go to bed, because usually Joey's not going to bed when you're going to bed, right? Joey's been sleeping all day while you've been at work. But asking them in chronological order what their cat is fed throughout the day. And it may be as simple as there's a bowl of food and it gets filled up once in the morning, or it could be that when the kids come home from school, there's a whole bunch of treats being fed because that's their regular evening activity with the cat. The more of this we can find out, the easier it's going to be to make changes. When it comes to the environment, we really need to understand the living situation. So is a cat living in a multi-pet household? Are they dogs, cats, or other animals? Are there individuals in the household that are maybe not as on board with, say, a diet plan, and they may actually be, undermining the diet plan at every turn by feeding, tuna every time they make a tuna sandwich? Those are sorts of things that can be very helpful, in addition to asking about some of the environmental needs that Liz talked about earlier. If we were to go through that evaluation and we don't check off any risk factors, that means our evaluation's complete. That cat is living in a wonderful situation. You give that pet parent a pat on the back and let them know to keep up the good work. Now, more often than not, there's going to be at least one, maybe two of these risk factors that are checked off. And this is an opportunity, by showing the cat parent the checklist, to start a conversation. We always, within shelters or within veterinary clinics, we get lots of experience, and it's very easy to look at a situation and to automatically just make a diet recommendation. The challenge is when we just make an automatic recommendation, even though there's been a whole thought process going on in our heads, we don't make that visible to the cat parent. And so they don't have the same information we do. And so this checklist works incredibly well, the same way Liz's checklist worked, to really make the invisible thought that's going on in our head visible to that cat parent. And I can tell you, when I go through and do this checklist, pet parents want to know, are the check marks good or bad, right? So you can imagine sitting in your doctor's office and they're taking a history and they're going through a checklist and you're like, oh gosh, are check marks good or bad? And what do I need to figure out? And so it automatically opens up a conversation because they're going to want to know what the checklist is all about. So this is a great tool. I have used this at some of the community veterinary outreach clinics, and it's been a great opportunity for us to have a dialogue about the pet's current situation. So anytime we go through that checklist and we identify risk factors, we're going to move on and develop a customized, individualized diet plan, because yes, all cats are individuals. And so as we develop that plan, we call it a nutrition support plan. It's a fancy way of saying diet plan. But if we do not monitor this diet plan, it will very quickly fall apart. And that's where the veterinary team plays a really key role. I can tell you, through years of experience, not only as a resident in clinical nutrition and then a clinician at the Ontario Vet College, but even during the time that I was working in general practice to try to stay afloat financially while I was living in Boston for 4 years, that it was not uncommon for me to read a beautiful medical record. My veterinary colleague had talked to this cat with this cat owner's had a wonderful cat, but the cat was already an 8 out of 9 body condition score. So that meant they were already obese. They did a lot of calculations. They figured out a diet plan. They recommended a dry food, a canned food, oftentimes even appropriate treats, sent the cat out the door and said, come back, recheck with us. We want to see how your cat's doing and let us know if this isn't working. how often did those cats come back to me as a 9 out of 9? They were heavier. I can't actually remember reading any records where they weren't heavier. And the challenge here was that I figured out I almost had to stalk my clients in order to get cats to lose weight, right? And so I became a bit stalkerish, which meant that there were lots of follow-up phone calls and follow-up emails. And what we would often do is when we developed a new diet plan, 3 to 4 days later, I would have either a technician or my work study student when I was at OBC call or email the client based on their preference and say, how's the transition going? Because if they haven't started the transition, we need to figure out what the barrier is because the cat can't get the benefit of the diet till they're eating it. So that first touch point allows you to answer questions and to make sure things are going well, especially if they're having a hard time. My next touch point was always at the 2-week mark. If I had a weight loss plan implemented, we needed to double check and make sure that the cat was doing well. This is an amazing opportunity to have a very positive vet visit. You can get little warmers, so you can put a warm blanket out, you can use your cat-friendly practice technique, and basically once the cat becomes comfortable, you'd give it a massage. And that is your body condition score, and it is a very positive appointment. They can keep some of the allotted food for the visit, especially if you've allotted a portion of treats. We want to see them because if the cat's not losing weight, we don't want to wait for a year. We want to get them on track so that they're doing well in that household. One of the other things that's been brought up tonight is resources. All of our clients are going to go on the internet, and I've heard Liz say this before, you know, dog owners will go to the dog park, cat people go to the internet, right? I am guilty of this. I mean, the cat was really invented for cute cat videos, right? I cannot tell you how much time I have wasted watching cute cat videos. And so it's very easy for our cat clients who want to be very well educated to go and surf the internet. And unfortunately, we know that no one polices the internet. So on your tables here tonight, and will be shared with our colleagues online, are some resources that can help set your kitty clients up for success. So one of these is through Wasaba. They have developed a tips for cat parents to surf the internet safely. And so it talks about things like basically everything you've wanted to say, like watching out for ratings websites, because they often rank foods based on marketing claims and cost versus the true nutritional value and science behind the products. There are a whole list of websites here, and it's great if a pet parent has concerns to actually highlight websites so that once they've heard you give the message, once they've got the message from the shelter, once the receptionist has given that message, once the kennel attendant who thinks the cat is adorable has given that message, they then go to the internet and hear the exact same message. And so yes, there are going to be other sources of information out there, but the more often we can repeat the same message, the better it's going to be for compliance. So great checklist here to consider. Another checklist that we have is this wonderful one on tips for selecting pet foods. Pet parents will spend extraordinary amounts of time researching foods. And one of the challenges here is while they're spending so much time doing it, they often don't have the right questions to ask. So oftentimes their search may be based on ingredients lists, which aren't going to tell us a whole lot about the true nutrition in the diet, or things like marketing claims, like we're looking at something that's holistic, which has no actual meaning when it comes to pet food. So this checklist actually provides 8 questions to help pet parents actually ask about things that legitimately are going to make a difference when selecting a food. So one of the things to ask is who formulates the diet. So ideally, Wasaba recommends that someone with a master's or a PhD in dog or cat nutrition formulates that food. So just because someone has a PhD, if it's in economics or soil science, that's probably not going to be best for making recommendations. Just because someone's a doctor, if they are a dentist, that probably does not make them a legitimate expert on pet nutrition. Other things would be, if they're making veterinary diets, do they have board-certified veterinary clinical nutritionists on staff? That would be another important question to ask. Can the company provide you with a full nutrient breakdown, averages of all the nutrients that are in that food so you can really understand the balance of that product? that company able to do any sort of testing on the ingredients that go into the food to make sure they're safe? One of the things that I've often had conversations with pet parents about is, do you consider everything that's sold in Canada to be safe? And oftentimes they'll say, well, yes, of course, if it's sold on the shelf in Canada, it's going to be safe, right? But yes, we have recalls for things like raw foods, which are frequently contaminated with things like listeria. And so we do have to ask the right questions about quality control to make sure those products are in fact safe to be brought into a household to be fed to our beloved animals. Other things that you may want to ask would be, when they're manufacturing the food, what sort of testing goes on at the end to make sure that the food is consistent? So it'd all be things that a pet parent could ask. And I've actually given this to clients as homework, because those people who are really invested in a company, and I can tell you I've dedicated the past, well, now 17 years of my life. I trained for 14. I've been adulting for 3 now. I have spent 17 years really focused on nothing but pet nutrition. And when I look at that, there are foods all the time I come across that I've never heard of before. And so there's absolutely no way for someone in a general practice that has to keep up to, I mean, do not ask me how to deworm a cat. I do not know, right? Because all I focus on is nutrition. And so you guys have to know so much. There's no way you could keep up with all the foods that are out there. So this can be really great to have clients take this home as homework, and they will do it. Your dedicated clients will do this. Get these answers from the company and then come back to you and you can talk about them. One of the other things that they say is the company producing any sort of peer-reviewed research that's put in veterinary journals. And so that's something that you can ask about. Now, Wasava makes a bold statement. They have stated if the company cannot or will not provide this information, that the pet parents should be cautious about feeding this food. And I think that's quite bold, but I think it's good. We need to be held to a very high standard. These are our beloved pets. And so Wasava is in the right to make this statement. The other thing I just want to mention about the internet, I'm sure you guys have come across this, but one of the challenges is pet nutritionist is not a regulated term. Registered dietitian for humans is absolutely regulated. You have to pass certain tests. You are registered. But you could call yourself a pet nutritionist if you take a 2-hour course online, and you can call yourself a pet nutritionist if you take a PhD for 5 years. So when a pet parent says, I read this on a website and it's from a pet nutritionist, we need to figure out what the actual training to become a pet nutritionist was. So one way to really have your clients assess resources is to talk to them about veterinarians who have specialized in nutrition. So diplomats of the American College of Veterinary Nutrition, like myself, there are a number of them that are blogging now, producing content for clients. And so this is something that they can use where they know that that person has at least undergone 9, 10, 12 years of training. And they are specifically invested in their cat's nutrition. So let's get on to growth of kittens. So we are back to our lovely little kitten. This is Mabel, and we want to absolutely set Mabel up for success. So how are we going to go about doing this? Well, one of the things we need to focus on is making sure that every bite of Mabel's nutrition is complete and balanced. And what I mean by that is that it has all the amino acids, fatty acids, vitamins, and minerals that she needs to grow properly. And so when I say complete and balanced, I'm looking for a diet that is complete and balanced for growth. So there's a couple of things that we could do to actually set those recommendations. So we could look at the National Research Council, and good pet food companies will use the National Research Council recommendations. They will also make use of the annually published American Association of Feed Control Officials recommendations. So taking those both into consideration, you can set up foods at a bare minimum to be complete and balanced. Now, by no means do I consider AAFCO to be a gold standard, but it is at least a baseline to say that that food should contain certain nutrients. Now in Canada, we have not officially adopted AAFCO as being some sort of national regulation. So this is very much voluntary in Canada right now if you are selling food within Canada. But I can tell you that there are a group of manufacturers that have formed the Pet Food Association of Canada, known as PFAC if you want to use the cool lingo. And that group of manufacturers, their names are listed online, and they have all stated that as a baseline, they will be using AAFCO as their baseline recommendation. So that can help you determine what manufacturers are meeting this at least baseline standard. One of the other things that we really need to focus on when we're talking about kittens is that they focus on aromas. Cats perceive foods differently than we do. We are very focused on flavors. You probably selected a variety of foods tonight based on flavors that you enjoy. Cats really favor aromas. And this is because they have many more olfactory receptors than they do taste receptors. The classic example is the cat with a terrible upper respiratory infection that will not eat until you nebulize it and clean up its nose and give it a warmed up canned food so all those aromas are emitted because it can finally smell again. Aroma is so much more important than flavor, and aromas that are familiar are very comforting to cats. So if we look at differences, just to compare cats to people, right, because they're not small people, they actually have 12 times more olfactory receptors than humans do, so smell is incredibly important. And when we look at taste buds, they have about 19 times fewer taste buds than humans do. And what taste bud are cats missing compared to humans? Sweet, right? So they don't have that sweet taste. And so they are going to perceive things much more differently. There is actually some research to show that kittens in utero, so when they are still in their mothers, can start developing preferences for certain types of food. So if you have a pregnant mother that you are looking after, feeding her complete and balanced dry and canned foods is very important because the kittens can start to develop some of those preferences even while they're gestating. One of the other things that we want to do in addition to aromas is focus on textures. It is critically important to expose all kittens to a variety of textures. And so I would be thrilled if every kitten was on both dry and canned food. There are absolutely benefits to both, but I want to make sure that they get this exposure to canned food. How many of you have been in a situation where you have an older cat with a urinary disease or a renal disease and they've never had canned food and you're trying to transition them to a canned diet because you know that's what's best? Getting a lot of nods here, and we all know how hard that is because it's so foreign to them. So we need to keep them exposed to canned food throughout life to set them up for success. Now, this is the one time in a cat's life where we do want to focus on them being in positive energy balance because they are getting bigger, they are laying down tissues, they are growing bones. And so we actually need their energy requirements to be positive, meaning that we are feeding them more than what they are burning so that they have the energy it takes to grow. This is the one time. If you end up in positive energy balance as an adult, right, you just put that all in your fat cells, right? And so that's what we want to avoid. And we won't talk about it more now because of the Thanksgiving weekend. And it may be all too near and dear to us, but we are going to focus on it when we get to adults. The 10% rule. Every kitten is adorable. And every adorable kitten can be overtreated, right? And they're doing cute things all the time, and it can become very easy to just shake the bag of treats. And it is so cute when they come running to the sound of treats, but very quickly we can unbalance the diet. So Wasava actually looked at a number of different pet foods and figured out that you basically had a 10% window. Once you exceed 10% of calories as treats or human foods or fat supplements, you will actually unbalance really nutritious dry and canned foods you're feeding. Because you start to dilute out all the nutrients like the vitamins and minerals by feeding high fat, high protein. And so 10% is the magic number. And so if a cat requires 200 calories per day, it's like a granola bar, right? It's not a lot of calories compared to someone that's a human. That would be about 20 calories a day that you would have safe as wiggle room for treats. Oh, this is one of my absolute favorite topics. Yes, we have a question. Oh, great question. So treats that are complete and balanced would definitely still be part of a complete and balanced diet. I would say that there are some diets that are complete and balanced, like your dry or canned food, that are going to provide more benefit to the pet then a treat. But if you had to go for a treat, complete and balanced is a great way to go. So that's a great question, because then you're, yes, exactly, because then you still got that window, right? So that's a great question. This is one of my favorite topics. Who here feeds their cat with a gram scale? Oh my gosh, I can tell you I am sadly cat deprived right now. I'm working on it, but I have an adorable little dog. She's a little Boston Terrier named Chickpea. And when I travel to Tampa tomorrow for a conference, Chickpea will be staying with my sister, who is the world's best pet sitter, because she weighs out 115 grams of Chickpea's diet every morning, and then we dole it out. So I have the world's best pet sitter, but you know what? It is so easy. She is not a morning person, and if she can do it, she said anybody can do this if I can do this in the morning. So the whole idea here is that measuring cups, we've got lots of different styles of measuring cups. There are a number of studies now that show these are incredibly inaccurate, especially when it comes to measuring dry food, because you can imagine, depending on the shape of the kibble or how they fall, or if you haven't had your coffee yet, or the pet parents who think everything should be heaping, this can be really inaccurate. So I want to show you guys some of the data. I was actually involved in a study where we interviewed 100 pet parents. And we actually, as part of this study, had pet parents take part in a little measuring exercise. So they were given 3 different types of measuring cups throughout this study. And they were asked to measure a quarter cup, a half cup, and a full cup of kibble. And this was just a standard round kibble. They then put that kibble onto a gram scale, and it was weighed. And then the student investigator revealed to them what they should have got had their method been accurate. And most of them were absolutely floored, because they would say, I swear to you, I have only been feeding, a half cup twice a day, and my pet is gaining weight. Well, I can tell you that for some of the pet parents that measured the quarter cup, they got almost double the amount they should have, just based on the fact that they did it a little bit more heaping than the next pet parent. So when we looked at the measuring cups, 85% of those 100 pet parents overestimated calories when they did the quarter cup, because it was so small, it was very easy to overestimate, and there were several of them that got double the amount. When it came to a half cup, it wasn't much better. 70% overestimated. And when we got to the full cup, it was a very similar story. 70% overestimated. So this has led me to one of my missions in life, which is #BanTheCup. And so I want to end the cat obesity epidemic. We know how much that impacts their quality of life. This has not picked up yet, but I swear one day it's gonna, and together we can make this happen. And it's really all about the demonstration. At the end of this study, we asked pet parents, now that they knew how inaccurate a measuring cup was, on a scale of 1 to 100, would they consider using a gram scale? And it was 77 out of 100. So setting up a little demonstration station in a shelter within your veterinary clinic, it's something that the reception team can absolutely own. You have a little whiteboard, you get every client that comes in to try to measure a quarter cup, and over the term of a month, you are going to have so many different variable scores that you're easily going to be able to show pet parents, 1, how easy it is to use a gram scale, but 2, how much variation there can be day to day. And even if they get the amount right on, well, chances are really good the next time they do it, they'll be off. And so it's a pretty hard feat to continuously get the exact number of grams. Now, pet food companies are catching on to the importance of this. And so you can look on the back of some bags now and you will find grams on the back of bags. So it makes this even easier for a pet parent. Oh, we wouldn't be remiss to not talk about poop, because this is a huge indicator of the health of a pet, right? Any of you receive photos of what's going on in the litter box? Yes, this is important, right? This is one of the ways that pet parents judge how their pet is tolerating food. And so for kittens, be very important to monitor their fecal scores. And every kitten should get a fecal scoring chart at their visit, because if they develop diarrhea, to avoid getting your inbox full of score 1s, then they can be trained to say, oh my goodness, we've had 6 of score 1. And then the receptionist can say, come on in. We've booked you an appointment, right? And then you can start figuring out, do they need to be dewormed? Is it stress? Have there been too many diet changes? What do we need to do to make this kitten feel better? Oh, guys, I have a dream. And I keep bringing this up because my dream is that one day all cats will be fed as individuals. They are all unique, right? They all deserve their own individualized diet plans. And I keep saying this, and I think I'm probably going to be 90 sitting in a nursing home. And I have this dream that when I'm in a nursing home, that I'm going to adopt fat cats and I'm going to do agility with them. And I've told my sister that we can do this together in Florida, and she is not 100% committed to the idea of this being her retirement plan. But I figure I have a few years to work on her. But if I keep saying it, maybe by the time I'm 90, they can all be fed as individuals. So how are some of you, I know some of you have multi-cat households, how are you feeding your cats individually right now? Separate rooms, excellent. Even if you have a studio apartment, you should have a door on your bathroom, which gives you 2 rooms, right? What else? Crates, excellent. And then the crate can be very positive so that it's a great positive experience to go in there so you can take them to the veterinary clinic. How else? Yeah. She has one with a feeding tube. How else? Yeah. Oh, the skinny cat box, right? So I can tell you this can work so well, and it can be a really cost-effective investment. I have had some big cats. You need to know the personality of the bigger cat in the household because some of them will move the earth to get that kibble, right? So sometimes you have to get creative, and maybe it's a crate, or maybe it's a see-through plastic box with a hole cut into it. And, you know, it's really nice. It's got a little blanket. It's very cushy. It's very friendly. It's never a stressful experience. Is anybody using automatic microchip feeders now? We talked about the importance of microchipping. Why not use that microchip to your advantage and actually have individual stations set up with microchip feeders? There are more and more of them available. And it's nice for our older cats that are used to grazing. They can actually go and the feeder will only open when that cat arrives. Now, we have heard stories of the other cat in the household hanging over the side of it. So you do have to keep an eye on them. Remember, cats are incredibly smart. So it's about figuring out what to do in your household. I met a vet when I was lecturing in London, Ontario, and she gave me this amazing tip. So she had a client that had 7 different cats on 7 different therapeutic diets. So you can just imagine this amazing owner. She's adopting all these cats with medical conditions. So blessed her for doing this. And she didn't have a ton of space. So 7 carriers was not going to be real practical. So what she actually did was she positively trained the cats to accept laundry baskets. So I can see how you could do this. You take a warm blanket out of the dryer, you spray a little Feel Away, you involve a little food, and chances are many cats will find that positive. Now, if you have 1 that won't or 2 that won't, you can always put them in separate rooms. But what this client would do is at mealtime, she would spread all the cats out, but because they accepted the laundry basket, she could place them over. And then when everybody could be done feeding, they could all be released from the laundry baskets. And that way, the cats that needed more time, they didn't have this interference from another cat. There was no one stealing their food. There wasn't aggression because they were protected. And so this was a really neat way. She just laundry hampers and the cats, and she had all 7 of them eating separately. So that would be a cheaper option if you could not afford 7 microchip feeders. But I have to tell you, I had a client at one point with 6 cats, and I made the mistake of saying, oh, you know what, I don't think the microchip feeders are going to be an option. You know, most of them run around $200. And she's like, oh, well, I only need 6 of them, right? And I said, yes. People love their cats. So don't go into it saying it's expensive. Make the option, because you will be pleasantly surprised what people will do for the love of their cats. Now, I do have a little video that I want to, oh, pardon me. A couple more slides first. The next one is that we do want to avoid free feeding. So free feeding is one of those things that gives nutritionists nightmares. So in an ideal world, we would feed cats at least 3 meals per day. So breakfast, when you came home from work, and then in the evening. you know how your cats will wake you up in the middle of the night because they want to eat? Well, that is a very innate natural cat behavior. In the wild, cats would eat an even number of meals throughout the day and throughout the night, and they would just nap intermittently in between. In fact, cats in the wild would eat 12 to 20 small meals a day, and if they happen to hunt more, they may do that just for fun. So you can imagine that we move them into our household and we're no longer having them hunt for 12 to 20 meals per day, and they can easily become bored. So the more meals you can feed them, the better. I have a rule that if they're working for their current meal and it's very small, they're not begging for their next meal. And so we do want to spread meals out throughout the day and night as much as we can. One of the other things we want to do, I mentioned, if they're working for their current meal, they're not begging for their next one, is to get them to work for it. So there are tons of different toys that you can get to make cats work for their food. You can also use puzzles, and this doesn't have to be an expensive puzzle. I've used with veterinary students who would have cats that needed some sort of environmental enrichment while they were studying. What we did was get plastic egg cartons. They could be washed, and you could put a little dollop of the canned food in each one of those wells. And then instead of just vacuuming it out of a bowl, they have to actually go along and clean it out. I've done the same thing with the little mini muffin containers for kittens, where they actually have to go and they get the canned food out of 12 little cartons. I did this recently with one of my friends who has a brand new kitten named Milo, and it took him about 25 minutes to finish his meal as opposed to about 2. So she was very pleased with this, and then I gave her the $4 muffin tin I got at the dollar store. Boxes. Boxes are incredibly cheap. What cat doesn't love a box? You can be sitting on the couch watching the hockey game with your beverage. You could be tossing a kibble in the box. Kitten goes in, kitten comes out. Then you toss another one in. Kitten goes in, kitten comes out. You could just make them do all the work, and you could be chewing for your teeth. Hide and seek. There are great toys out there that can make cats do all the hunting. So the No Bowl is one of them, where you get a number of mice and you can actually put the kibble in their little bellies, then hide them around the room for that individual cat to have to go hunt and find them. And I think that's a fantastic idea. And then, of course, there are opportunities to use food for training. And cats, yes, can be trained to do amazing things. So I want to show you a quick video here. To get a workout. Giant hamster wheel. That other cat is just like, oh my gosh, when is it my turn? He's got to do the hamster thing. He's got to jump on there and go in the opposite direction. That's what they always do. There is this great opportunity for us to train our cats to do positive things. And usually, yes, it does take some positive reinforcement, but you can use their kibble. So I do want to ask for a couple of volunteers right now. We've talked a lot about environmental enrichment, some cat-friendly practice techniques. So we want to make sure that we are making veterinary visits and every part of their household as stress-free as possible. So in honor of that, I would like to have a couple of volunteers who would want to show me their best impression of what a stressed out, fearful cat looks like. Do I have a volunteer? Anybody want to volunteer? I tell you the prize is a good one. I'm going to wait. Someone will do it. It could be a little bit of, okay, someone do it. Do it. No, you can do it right there. You just show me a stressed out cat. Oh. And through our learning tonight, and thankfully she has you now, she's working on that, right? She's got a much more fear-free type of environment. So, well, because that stresses her out, right? So you're meeting her needs, which is great. So thank you so much for being a brave volunteer. I can tell you that your cat is now the lucky new owner of a $500 cat wheel. Yes. So maybe what you can do is channel some of that energy in a more positive way. So Monica will hook you up with your cat wheel at the end of tonight. So you're welcome. Your lesson has been, it's good to volunteer. These are Dr. Anne-Marie German's cats, and she has actually recently told me that they actually will compete over who gets to sit on the scale to be weighed first. So they are trained to do this, and this is great because if we're weighing our cats, it's very easy if you see a pet every day that their weight can gradually creep up. So if you can weigh them every day, or not every day, once a month, you can actually trend if they're starting to gain weight. And then Dr. Germain actually adjusts their food if they're starting to creep up a little bit. So this allows them to maintain a perfect body condition score. But it doesn't stop there. These cats actually beg for playtime. They're not begging for their food, they're begging for playtime and interaction. And so they get to do agility, they get to do tricks. And so cats just have all of this unleashed potential that through the right resources, providing the right needs, every cat can be really magnificent in what they do. Oh, these cats have the greatest life. So the goal here is, of course, to feed cats to meet their needs as well. And during adult maintenance, again, we want to make sure that every bite of canned food or dry food is going to meet all of the needs that that cat has every single day to do well. So we'll use similar guidelines and recommendations, but using them for adult cats. We, of course, want to continue their exposure to both dry and canned foods. And I can tell you, when I was doing general practice appointments, I invested so much time in trying to get my clients to brush their cat's teeth. And I had little handouts, I had little videos, I would do demonstrations. Do you know how many clients I got to brush their cat's teeth? 0. And so usually I find the people who brush their cat's teeth are people like are in this room, right? That's us. Or vet students, veterinary technician students. But I decided that what I needed to do was actually spend my time focusing on a diet that was going to prevent that buildup of both plaque and tartar. So for my adult cats, I do like them to be on a diet that is going to promote dental health, and then I like them to be on a canned food as well to complement that, because I can see lots of benefit to preventative nutrition here. Another example of a preventative diet would be a cat that requires some sort of a support for its joints. Remember, a joint diet always works best during the mild stages of arthritis, when there's actually joint tissue there for the nutrients to benefit. In the very severe stages, if all that joint tissue is gone, there's nothing there for the nutraceuticals to work on. So we want to get those diets on preventatively. Body condition, and every one of my clients used to go home with a body condition scoring chart, remembering that a 4 or a 5 out of 9 isn't ideal. So a 4 out of 9 cat has no abdominal fat pad. A 5 out of 9 cat has a very small abdominal fat pad, but you can feel all of the abdominal muscles. So you may be thinking to yourself, oh goodness, you got to get a buddy to body condition score your cat, because in our eyes, as the pet parent, they're all perfect, right? So you have to get a buddy. If you're afraid that they're going to tell you something you don't like, pick someone you don't like to come over and body condition score them. That way it doesn't ruin your relationship. But remember that any cat that is over-conditioned can benefit from a weight loss plan, because not only does this predispose them to many diseases like arthritis, constipation, diabetes, feline inflammatory cystitis, feline idiopathic cystitis, pardon me. We really want to focus on their quality of life, and cats being overweight is going to affect their quality of life. So we mentioned that we do want adult cats to be in neutral energy balance. So whatever they take in balances what they're burning. And cats don't burn a lot throughout the day. It's usually about 200 calories a day or less. Unfortunately, we see many situations like this character that I introduced you to earlier that is very overweight and in fact obese and requires a weight loss program. And the only way that happens is to put the animal in negative energy balance. There are tons of fad diets out there. Unless the diet fad induces negative energy balance, where you are burning more than you're taking in, weight loss will not occur. Now, there's a couple different strategies that people may want to employ to get a cat to lose weight. And so one of them may be that you stay on the same diet, but you're just starting to measure it. Maybe the cat was free-fed before. The other one that you may hear is, keep on the adult diet, measure it, but just cut out all the treats. That's another option I've heard. Or potentially you switch that cat to a light or weight control diet, something that you could purchase over the counter. The other option would be to choose a prescription or a therapeutic weight loss diet. Now, if we already have an overweight cat, there is only one option up there that is safe for weight loss. Which one is it? The therapeutic diet. So light and weight control diets absolutely serve a great purpose. These are great for our indoor cats before they become overweight. These can be preventative diets. Once they need weight loss, we absolutely need a therapeutic diet, and I'll show you why. If we look at the way diets are formulated, a cat actually needs to eat a certain energy to get all the nutrients that they need. And if you start cutting back, what ends up happening is if you cut back too much to get the energy low enough for them to lose weight, you run into nutrient deficiencies. So once the pet has a medical condition, that triggers you to get a therapeutic diet. So if we look at therapeutic weight loss diets, they are formulated differently. They are lower in calories so that we can actually keep cutting back safely so that we're not going to see deficiencies in amino acids or fatty acids, vitamins or minerals. And this is a really actual problem that has been studied through research where we can see nutrient deficiencies induced by just cutting back maintenance diets. And the reason I make a big deal about this is no one ever told me this during vet school. I didn't learn this until my residency, and my mentor actually made me go through the process of calculating, and very quickly I saw nutrient deficiencies. So very critical, once we have a pet that is overweight, that we need to actually induce weight loss properly. Of course, a weight loss plan is likely not to be successful if we're using a measuring cup. So you can imagine you're like, oh, they need to be somewhere between 1/3 and 1/4 of the cup. Well, we know that's just not going to be accurate. So it's really easy to make adjustments with a gram scale, because if they've been losing weight on 55 grams of food a day and they plateau and they're no longer losing weight, you can easily cut back to 52 grams. And it just gives you that accuracy to keep the pet on their weight loss journey. I do not cut treats cold turkey when it comes to weight loss, because I've found that it ruins my compliance. So I want to use treats, first, that I know the caloric amount of the treats. Second, that they are low in calories, so that there can be a few of them given. And they need to go in a little jar on the counter so that everybody knows once Wednesday's jar is empty, that was all of the allotted treats for the cat for the day. And we need to wait till the next morning before we fill it up again. And transition slowly. Remember, weight loss, this is a long-term goal. It's likely going to take a cat that is a 9 out of 9 over a year to lose all that weight safely, because we want them losing at about 1 to 2% body weight per week. When we look at that, if it takes that cat 3-4 weeks to get onto a diet, because literally to control their stress, you have to pull out 1 kibble at a time and transition it. And I have had clients that have done this. But that's what you need to do, because it's a long-term plan. So go as slowly as the cat needs you to. And one of my big tips is to tell the client to get a glass of wine and don't act weird when they put new food out. You know, when clients will stand there and they're like, are you going to eat it? Are you going to eat it? And of course they're like, oh my gosh, what have they done to my kibble? What have they done to my canned food? So just act chill, get a little glass of wine. If you don't normally watch your cat eat, don't watch them eat, and do the transition as slowly as that cat feels comfortable. Oh man, we are not going to get a cat to lose weight if we don't feed them with individuals. I have heard the strategy, and sometimes this is unavoidable in a shelter environment, but we can have those strategies where, you know, there is an obese cat room and they're on a weight loss diet, but if there's one bowl, they will all continue eating as much as they want. And so if they're free fed, ultimately, they're all going to either continue to gain weight or stay the same weight. So a strategy that you could use in a shelter environment would be to get someone to donate old cabinets after a kitchen renovation. You basically put a little $30 indoor-outdoor cat flap on it that only one cat wears the collar for, so they can get in and out of their cupboard, and that can be their allotted food area. And so you could just get a bunch of cupboards in your overweight cat room, can set them up for success that way, because they really do need to be fed individually, but we also want to meet their environmental needs in other ways. And monitoring is going to be critically important. So this is a way to show a cat that a vet visit can be positive, as I've mentioned before. We also have to set realistic expectations. If that cat has been begging for food in the past, they are going to beg for food when they go from positive energy balance to negative energy balance. That is inevitable. So I want you to ask that pet parent, what is that cat's absolute favorite thing to do in life that does not involve eating? And it could take a while, but maybe it's brushing. Maybe it's getting patted and sitting on the couch with you. Maybe it's getting a new box. And so every time that cat begs, they're going to get the brush out and they are going to brush them, or they're going to pet them, or they're going to give them a box. And their living room may be full of boxes, but it's not giving in, right? And eventually you can retrain the cat. I do want to tell you a little bit about Candace. I mentioned before a cat that was surrendered not once, but twice. And Candace was so overweight, she could not groom. She was not going to the bathroom in the litter box. And so she got surrendered. She was almost 12 kilograms at the point of surrender. So I want to show you some videos. This is Candace. You're noticing how difficult it is for her to walk. And even with food at that point, she wasn't even really convinced that she wanted to walk. So thankfully, she was surrendered to the Toronto Humane Society. And Dr. Tara Edwards, who's a canine rehab specialist, started working with her. Look at her poor legs. That's exactly what I thought. Awful. Bless you. So this is Candace, and she started to lose weight on her therapeutic weight loss program. She was on a therapeutic weight loss diet, and she ended up losing 2 kilograms. And look at, she's actually interested in moving and working for her food now. She was being treated with all sorts of modalities because, of course, we need a multimodal approach for arthritis treatment. And they would save up her food for her rehab sessions so that it would still be within her daily allotment. She actually became internet famous, so you can follow her at Cat Can Do, or at Cat Candace, or Cat Can Do is the hashtag. And that was thanks to the Veterinary Emergency Hospital and the Toronto Humane Society. So this is Candace after her weight loss program. She is now 7 kilograms, which was 41% of her body weight. And this took approximately 2 years because, of course, she was in a couple of different environments. But ultimately, 6 months after this photo was taken, she had been off all non-steroidal pain medications because just with weight loss, she was able to get around so well. And you saw how hard it was for her to walk. Weight loss is tremendous when it comes to quality of life of arthritic patients. The last thing we need to talk about is our senior cats. And one of the challenges here is that there are no guidelines for senior cats. That's because it would be impossible. Our cats receive such great care now, such great nutrition, that those that are living a long life, they develop different diseases just like we do as we age. So we see chronic kidney disease, we see liver disease, we see GI disease, and each one of those has very specific nutrient needs. So as a result, we could not set a one-size-fits-all requirement for a senior cat because they are truly the epitome of individuals. This is where our nutritional assessment is crucially important because we are going to start to find challenges here, and the more quickly we can start doing our monitoring with our CBCs, our chemistries, our urinalysis, our fecal exams, we can start noticing problems sooner. If you can diagnose kidney disease in the early stages and put that cat on a low phosphorus diet consistently, you can prolong their life. That's the power of nutrition and preventative diet. I mentioned that I would talk about body condition scoring and muscle condition scoring, and this tool has been provided to you. Sarcopenia happens in cats as they age. It is muscle wasting that occurs with aging. Unfortunately, all of us are going to become sarcopenic at one stage. I know, lots to look forward to, right? But it's one of those things that we as humans and cats, we're just not set up for success for having lots of muscle mass as we age. It's a really good reason you don't see lots of, jacked grandpas running around nursing homes. You just don't maintain muscle as you age. And so cats will develop normal muscle wasting. The goal is we want to keep it to a minimum. What we want to avoid is cachexia. That is muscle wasting that happens with disease. And so the goal there is to control the disease. And we also need to make sure our senior cats, because they do not digest things as well as they used to, their energy requirements increase. So they need to eat more food and have a more highly digestible diet as they are seniors to maintain their body mass. It does not matter how much protein you feed a cat. If they are in negative energy balance, they're going to burn through their muscle. So the key is always to get them their energy needs, provide them with adequate protein, and then if you can, exercise them so that if they don't suffer from that loss of muscle due to disuse. So yes, it may be going up 1 or 2 stairs if that's what it is, but it's still movement, and that's better than no movement at all. I will give you a quick tip. If you were to run your hand along the back of your cat, it should actually feel like the palm of your hand. There shouldn't be any bones protruding. That would be normal muscling, because we want there to be just a nice layer of fat and muscle so that we're not feeling any of the spinous processes of the vertebrae. Now, if we hold our hand like this and you run your hand along your knuckles, this would be the equivalent of mild muscle wasting along the spine. If you arch your hand just slightly here, this would be moderate. And heaven forbid, if you close your hand like this would be severe. This can be a way to help keep everybody on your team on the same page. So normal, mild wasting, moderate, and then severe. The place they're going to show this first is in their spine. And again, it's really about calories and adequate protein and movement. The last thing I will mention is we, of course, need to be proactive. We want our cats to live a long, healthy life, so we need to monitor them. And with that, hopefully you have taken away some tips to keep cats in their forever homes. Hopefully we put the roof on the house. So now that these cats have all of their great preventative care, they've come prepared from the shelter. They definitely are free of rabies when they interact with those indoor bats. We now have a way to make sure that their quality of life is fantastic in that household, and that hopefully we've seen the end of cats being surrendered because they are overweight and can't use the litter box. So with that, I will finish and thank all of you for joining us this evening.
Thanks again, everyone. I know we promised 9 o'clock, 9:07. It's not bad for Jackie. Anyway, thank you again so much for attending. I'm Grumpy Cat. I have to give you the rules, and I have to ask you to do homework. So if you could please take a moment, if you haven't already, to fill out the surveys on your table and then leave them behind for us. Also, this is being recorded, so if you have any friends who missed this talk this evening and you think that it would be of benefit for them to see it, we will have this available online afterwards that we can send out the link to you for. Cvent, the program that sends you your reminder emails, will actually be sending out a second electronic survey. So if you have time, it takes about 5 minutes to fill those out. And the other thing that Cvent will also send you is a certificate of attendance. So with that, I'll pass it back to Fun Cat, Emily, for a final thank you.
Thank you very much. I think it's fun, and Fun Fat Cat, I think, is more appropriate, which is okay because we love those just the same. So just to sum up this meownificent evening, this event really couldn't be possible without this entire community of dedicated individuals making a better world for cats. So that includes the folks who joined us on the phone, that includes the folks who are sitting here in this room, the people behind the scenes who also made this night possible, and most importantly to our visionaries and our guest speakers this evening, Marion, Liz, Jane and Jackie, thank you so much for sharing your knowledge with us this evening. We have a small token of appreciation. It's a bottle of maple syrup tapped from our very own trees at the plant, which I think is fully balanced nutrition. If you ask Jackie, maybe not so much. 10% only. Other than that, folks, we're not kidding around. You can go home now. Thank you.